May 12th, 2021 virtual meeting of the Anne Arundel County Council is now in session. Today we will sit as the Board of Health and then continue with our review of the proposed FY22 budget. Madam Secretary, please call the roll.
Good morning. Ms. Lacey.
Present.
Ms. Pickard.
Present.
Mr. Volke. Mr. Pruski.
Here.
Ms. Fiedler.
Present.
Ms. Rodvian.
Here.
Ms. Hare.
Present.
Michelle Beaulaire, our County Auditor.
Present.
Madam Chair, Mr. Volke has not yet joined the meeting. However, we have 6 council members and our County Auditor in attendance.
Thank you. Please pause for the invocation and the Pledge of Allegiance led by Ms. Hare.
Sorry, also computer issues. Let us be thankful for this day that we have been, for its blessings, its opportunities, its challenges. May we appreciate and use each day that comes to us to the best of our abilities through collaboration and kindness. Let us seek strength and guidance for each day's duties and problems and be challenged to give our best always together. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Madam Secretary, please read the Open Meetings Act statement.
The County Attorney has asked me to read the following statement. The Maryland Open Meetings Act is a state law that requires public meetings to be open to the public and to be held in places reasonably accessible to individuals who would like to attend these meetings. The virtual format of this meeting of the County Council is due to the COVID-19 pandemic and is necessary in light of the health risks associated with public gatherings. While a virtual meeting of this type was not envisioned by the Open Meetings Act, steps have been taken to ensure that this virtual meeting includes alternate accessibility features that the Open Meetings Act Compliance Board and the courts have reviewed and approved, such as having a call-in phone number that allows anyone with a telephone to call and listen to the meeting, and broadcasting the meeting with video and audio on cable TV and the web. The public access provided by this technology makes this virtual meeting reasonably accessible to the public as required by the Open Meetings Act. This technology also satisfies the intent of the rules of procedure of the County Council that apply to meetings, and they do not need to be waived in order for this virtual meeting to be held.
Thank you. Is there any item any council member would like to place on the agenda? Seeing and hearing none, the council will now sit as the Board of Health. Dr. Nilesh Kalyanaraman, our health officer, will be joining us. Good morning.
Good morning, Madam Chair.
Thank you for joining us. I'm sure you will call on other people from your department as necessary. Please go ahead.
Thank you, County Council, for having me here. I'm going to share my screen, so give me 1 second and I will get this set up. So as I mentioned, thank you for having me here today. I am Nilesh Kalyanaraman, the health officer for the Anne Arundel County Department of Health. I have our key staff here, and I want to take a moment to thank the leadership here at the health department. It has been a year unlike any other, as you are all well aware. And they've stood tall, leading their departments in the county in this time of need. Tony Gedden, our Deputy Health Officer for Public Health, Sean Kane, our Deputy Health Officer for Operations, Billy Penley, our Chief Financial Officer, Sandy O'Neill, our Director of Behavioral Health Services, while our Director of Disease Prevention and Management is vacant. Becky Asher just retired a couple of weeks ago, and she was critical in our response to the COVID pandemic. Don Curdian, the Director of Environmental Health, Karen Siska-Creel, our Director of School Health Services, Tom McCarty, our Director of Family Health Services, Ellen Jones, our Public Information Officer, and Crystal Coldiron, our Director of the Office of Assessment and Planning, Normally, I include their names for information, but I thought it was important to share that they have been instrumental in the work that we've been doing as are the nearly 900 staff we now have at the health department in responding to this pandemic and also continuing the activities that we do on a daily basis to protect the public health of the county. Highlighting our partner agencies, Adrian Michler at the Mental Health Agency and Pam Brown at the Partnership for Children, Youth, and Families are also critical partners in our work. Brief overview. Last year, our employees stood at around 711. We have expanded by about 25% in terms of personnel, and that is solely and directly in response to the COVID pandemic, nearly 25% increase. We have a number of different offices throughout the county, including a new one in Glen Burnie at Bay Meadow, which is where we center most of our COVID operations for the county. As always, the vision of the health department is a vibrant and Anne Arundel County with healthy people and healthy communities. And our mission is to preserve, promote, and protect the health of all people who live, work, and play in Anne Arundel County. I'm going to start with COVID. We have talked about that a lot, so I'm not going to go in full detail. You all should have received a fairly lengthy slide set. I aim to only go through about half of those and take up about 20 to 30 minutes in talking and then open up the rest for questions. So as we all know, COVID first appeared in Maryland in March of 2020. Now, 14 months later, we have over 43,000 cases and 590 official deaths, additional 14 that are suspected and not registered as deaths due to COVID. So over 600 at this point in Anne Arundel County. Our case rate, as we look and track it over the past 14 months, we of course had a very high case rate, a high of 64 just past winter. And we have been steadily coming down over the past few weeks, past month or so, and they're down to 10.8, a level we haven't seen since November of last year, so almost 6 months ago. Critically, as we are vaccinating, we're really looking at hospitalizations. We have always been looking at hospitalizations, right? The reason we care about COVID is because of the severity of the disease, both in terms of hospitalizing people and in terms of causing death. And our goal in vaccinating people is to break the severity. So we know that people will continue to get infected even if they've been vaccinated. But the point of the vaccines is to prevent the severe outcomes, so hospitalization and death. And we saw that our vaccination, you can see from this that our vaccinations began during hospitalization, that hospitalization spike in the fall. And really we didn't have enough penetration of the vaccines to break that hospitalization cycle, but that's what we're going for. Why does this matter? Because when we see the cases and deaths by age group, we see the cases are pretty distributed throughout the ages and actually concentrate more towards the younger group. And those are our blue bars. Our red bars are the deaths, and we see the deaths are concentrated at the higher age ranges. Now, the issue is because this is a transmissible disease, we have to protect everybody, because when a 20-year-old gets it, even if they're going to do okay, they are likely to spread it to somebody who's older who may not be able to survive it. That is why our vaccination effort is focused on getting everybody vaccinated. Also, when we look at cases and deaths by race and ethnicity, we see that Blacks have suffered a disproportionate level of cases and deaths. We see a slight increase in deaths for whites, and that's largely concentrated in the oldest age groups. And then for Hispanics, we see a slight increase in cases, but not deaths. And this is the importance of looking at data disaggregated to be able to understand the smaller trends that are in the large trend line that we see. When we're looking at vaccinations, nearly 60% of Anne Arundel County residents age 16 and older have had at least one dose of the COVID-19 vaccine, and over 44% are fully vaccinated. That translates to about 48% of the total population. So we still have a ways to go to get to herd immunity, which will take about 70 to 80% of the population. And as you can see in this chart, the penetration of vaccination in the older age groups is obviously much higher And we're seeing that about 85% of those over 75 have gotten at least one dose. And that trails off significantly into the lower age ranges. Oops, sorry. We've talked a lot in the past about our COVID-19 response. I'm not going to go through it all, but this is just a summary of the various aspects of the response that we have been either directing or a part of in the county over the past 14 months. Testing, vaccinations, contact tracing, our call center and email bank, which have been a critical source of information for the community, case management, our isolation and quarantine protocols, education, community business and agency guidance, enforcement, mental health resources, and vulnerable population support. I'm just going to highlight the vaccinations. And one of the things that we saw right at the beginning of the vaccination effort in late December, early January, was that there was limited supply of vaccine. As time has gone along, more vaccine has become available. And currently, this is where we are. The health department are operating large vaccination sites. So in Arundel Community College and Maryland Live Casino, we also have drive-throughs in Glen Burnie. We have smaller sites at the O'Malley Senior Center in Odenton, Lula Scott down in South County, Pet Moyer, Homebound Initiative, which is growing, our mobile vaccine clinics, which have been a critical part of our ability to vaccinate in communities. And of course, the range of partnerships we have with Arundel Medical Center, Baltimore, Washington, and then the city and county fire departments, critically the county fire department, which has been a solid partner throughout all of this. And this is in addition to the pharmacies and growing number of doctors' offices that are carrying the vaccine. This is just the data that I shared a little earlier, that 44% of the county population, this was as of a few days ago, has at least one dose. That number is up to 47 now. And one of the key things we keyed in on was health equity during this process. I talked a little bit about the data. We looked at the data not just from race, ethnicity, age, but also location, and based on census tracts. And out of that came our principles for equitable vaccination, which we focused on three major areas: the access, communication, and engagement. I have been providing grant-funded outreach to provide rent, utilities assistance, medical and hygiene care packages, and health education materials. And then critically, just a week ago, we launched our Health Ambassadors Program, which funds 9 different county community-based organizations to do outreach and engagement around COVID safety and vaccination. I want to pivot to some of our community initiatives. One that we've talked about is our Healthy Anne Arundel Coalition. And this is a county-wide collaborative led by the Department of Health. And it brings in community organizations, faith-based institutions, economic development, our federally qualified health centers, and hospitals and county government agencies. And the power of this is that it identifies and addresses communities' priority health needs as determined by the community. Oftentimes we look at the data, we decide what's important, but what people are going through in their communities, they'll make different decisions as to what's important. We get into these situations where there's discord or conflict, when health systems want to do one thing, public health wants to do one thing, and our residents say, no, that's not what's important to me. And so after a 3-year hiatus, we relaunched this. We had the misfortune of relaunching this right as we were heading to the pandemic. But we did have our first community kickoff meeting on October 1st, 2020, with over 150 participants from around the community. And what came out of that was two priorities that we're now focusing on: mental wellness, and we have a mental wellness work group working with our mental health agency and our behavioral health team here at the department, and a range of other behavioral health providers throughout the county, to focus on what it is that folks in our community say is lacking or needs to improve, and how to do that in partnership with our communities. The second is our healthy eating and active living. And that's really focusing on nutrition, exercise, weight as a way to improve health in our community and really look at it from a much larger perspective than just healthcare and looking at targeted interventions. We want to build this into our communities. How do we support and promote healthy eating and active living? And then as we go along over the course of the year, we will select the third priority as these two get launched, and we should be able to talk about that when we return in October. Another key initiative of the health department is our health equity and racial justice work. Talk about health equity means that everyone has a fair and just opportunity to be as healthy as possible. We've shared data that shows that racial, ethnic, income, and geographic disparities are persistent in our health measures, and the county declared racism a public health issue. And so we stood up the Office of Health Equity and Racial Justice. This has been about a year, and it has been focused on our COVID-19 response. Some of you have participated in our COVID-19 Health Equity Initiative, which launched in April of 2020, just a few weeks into the pandemic, to ensure that the strategies that we were promoting to address COVID in the county were leading to equitable outcomes. One of the biggest challenges we've had, and we've seen this with vaccines, is that while we are justifiably keyed in on speed, equity has to be a co-equal in that equation, and we have worked on that, and we will continue to work to make equity co-equal with speed in terms of a response, not just to COVID, but to other public health issues. I've included, some of the symbols came out a little strange, but I've included some of the work that has been done and the progress that we are in the middle of in terms of our COVID-19 Health Equity Initiative. Another key priority is gun violence. We know that, and we talked about it here, that gun violence affects all people, but it disproportionately affects young Black males and older white males. And critically, we see that older white males are more likely to be victims of suicide when it comes to gun violence, and with 80% of suicides in white males, and 50% of the homicide victims by firearm occur in Black males. And this is an example of what we mean by disaggregating the data and breaking it down. What this allows us to do is to better understand the texture of what's happening and to better target not just our discussions, but our resources to address those groups. Our gun violence intervention team addresses gun violence as a public health issue. So what does that mean? That means we focus on the violence piece. A lot of the conversation around gun violence centers on guns, more guns or less guns. And really at the end of the day, the problem that we have from a public health standpoint is the violence that comes from that. And our goal is really to reduce violence. And it's one thing that I know that we all agree on, is that we want to reduce that violence. And so this is a multi-agency effort. It's focused on reducing death and harms from gun injuries. And it utilizes a policy, systems, environment, public health framework, which is a framework that we use in a variety of public health issues when we're trying to tackle complex, multi-causal problems like gun violence or like opioids. And that's why this gun violence intervention team is modeled on our opioid intervention team. We have three priorities that have come out of this intervention team's work. One is on data, to create and publish a monthly and annual data report on our policy and prevention front, to implement a public awareness campaign about gun safety. And then from the environment standpoint, implementing a coordinated crisis response for reporting and following up on gun-related incidents, including a crisis response workflow. And you'll see that in each of these, our focus is really on how do we decrease the violence and injuries that come from that come from guns? How do we reduce that in our community? Critically, we're having a community event on June 3rd and 4th. That is National Gun Violence Awareness Day, where we'll be talking more about these three priorities, setting out our timeline for accomplishing these, and we'll have a number of speakers joining us for this event. Key in this is also suicide prevention, and we talked about this as well previously. Our suicides decreased from 79 in 2018 to 75 in 2019. Unfortunately, due to the pandemic, a lot of the data that we rely on that comes from the state and the federal government is over a year and a half delayed. And so we do not have 2020 data yet. That said, we will continue to work on this area. As we noted, the gun violence and prevention team will have a focus on suicide since it accounts for over 60% of gun deaths. And we continue to work to address the youth suicide report findings. Two key things I wanted to highlight is our mental health initiative for older adults, and that's being led by our mental health agency, and then our STAR program in schools, which does connect students to mental health in the school setting through telehealth. And so that's a good segue to some of our core activities that are going on every day, COVID or not, our behavioral health system. And I'm really proud of the close and tight collaboration between the Department of Health and the Mental Health Agency. That is not necessarily the case in all counties. And our close collaboration allows us to really facilitate a strong local behavioral health system that can develop an integrated process for planning, policies, services, so that at the end of the day, our residents are getting a quality system of care. It spans a number of, or four, to be precise, four approaches along a continuum: prevention, intervention, treatment, and then community recovery support. So we'll talk a little bit about the continuum of care as we're talking about behavioral health. And it's really keyed in on this graphic. If you take nothing else, take this graphic as a way of how we think about this and recognize that people sometimes people can be in different parts of this circle at different times in their life. And our goal is to really help them move through this. Oftentimes we want to focus on prevention, but sometimes people need intervention or treatment. And then we want to get them to community recovery. When we talk about something like a relapse, they might need treatment again, but we are always working with folks to continue to try to move them along towards health. One program that I wanted to highlight was our Strengthening Families program. It's an evidence-based 14-session program. It provides training in parenting and focuses on children's social and life skills, helps to strengthen families as we know it. And this was a program that was reconfigured for a virtual platform while maintaining the fidelity of the model. It's actually one of the key interventions we have to address substance use disorder in families and work through the various issues that families encounter in addressing substance use disorder. A lot of our discussion focuses on individuals, but we know that particularly parents cannot get better if we do not take care of their family as well with them. Our Wellmobile, which we've talked about a lot, provides on-demand initiation of buprenorphine services. During COVID-19, it's been virtual, so that means that it's been telehealth for the entire county from Monday through Friday. And that's actually been a fantastic intervention. It's allowed a much wider range of people to get access to the services, and we're going to talk about telehealth in a second. But we also do or offer on-site services. Two of our clinics, one in Glen Burnie and one in Annapolis. Key to this is that we do provide buprenorphine. People can walk up and start buprenorphine services, and the goal is it's short term. It's meant to be for a few weeks while we transfer them to a community provider. And 84% of those referred kept their initial appointment. So one of the critical things during COVID that's been something that's got really positive effects and we want to see carried through is telehealth. Temporary expansion of Medicaid regulations allowed the delivery of telehealth services. They've been in effect during the pandemic. This is an area that we've been talking about and going on and on about. And frankly, in the healthcare world, it really comes down to reimbursement. Well, the pandemic forced the issue. And what we found is that the people we're serving and throughout the county, and we've heard this from a range of providers from our larger systems who are smaller individual therapists and psychiatrists, have found that they can effectively deliver services to a lot of people, whether it's through an audio-only platform or through a video platform. And patient reports suggest that there's a benefit to continuing telehealth and a hybrid model of care. So it's really not an either or situation. It's not in-person or telehealth, but what combination is going to work for providers and for people seeking services. And so what we found is that in our adolescent and family services, while sessions were shorter in length, there was a 16% increase in the number of services. We had an increase in the percentage of services that were completed. So 87% of services versus 73% the prior year, fewer cancellations. And we're seeing that, we're seeing the same thing in our Road to Recovery, which is our substance use disorder services. 91% of services were completed compared to 84% the prior year. So it does have benefits, particularly in helping people with navigating issues around transportation, taking time off from work, those sorts of issues. This can be a good way to get around some of those barriers. We've also launched a hub and spoke model for medications for opioid use disorder. And this is actually a critical innovation in terms of our ability to treat opioid use disorder. It supports treatment within the chronic disease paradigm. So as we were talking about just a few minutes ago, that model of care, the chronic disease paradigm says that people are along spectrum. Sometimes they have uncontrolled disease, sometimes they have moderately controlled disease, sometimes they have well-controlled disease. And as time goes on, people can move backwards and forwards within that continuum. Well, the hub and spoke recognizes that and operationalizes that idea. And it also operationalizes the idea that, while buprenorphine isn't the only treatment for opioid use disorder, it is the most effective for a large number of people. And so in this hub and spoke, our Road to Recovery program is the hub. And what it does is it allows us to engage people in care who are getting buprenorphine, to initiate care, get people stabilized, and then to transfer them to community providers. And we have 10 community providers now engaged. And what the goal is to outreach, to engage new prescribers, get them involved in the program, provide learning collaboratives that enhance the skills of prescribers, and allow us to transfer those folks who've been started on buprenorphine once they are stable to these providers. And as those providers get more comfortable, if they are interested in initiating and starting treatment, they're welcome to, and if not, that's okay. It creates the continuum of people getting treated. But I think critically, what this allows providers to do is that if they start having trouble with a patient who is starting to use more, the buprenorphine is not working, there are other issues, it allows them to transfer to a higher level of care, back to our Road to Recovery program. And in that way, much as we might with some other medical condition, chronic disease, medical condition, where if you need a specialist for a short period of time to bring your, let's say, your heart failure under control, you do that and you return to primary care. This is exactly that model. So these services began just this month, and we're really excited about seeing how this develops and talking more about this. Along the same idea of providing care when people need it at the right time, our safe stations, which are operated through the fire department, are a key intervention. They're available 24/7, 365. Any individuals are welcomed into police or fire stations seeking substance use treatment, and I focus on fire because that's where we get the most number of referrals. And having staff assess those individuals, and together they can develop a plan of care, is a key component in making behavioral care accessible when people need it the most. Another piece is our harm reduction services, our overdose response program. It's free and open to anyone. This is where we do overdose prevention education. And also provide Narcan to people. So that's the brand name for the naloxone, which reverses overdose from opioids. A new program that we have that started in November of 2020 is our syringe services program. We are one of 19 programs in the state arrayed across 9 different counties. And syringe services are our harm reduction program that are promoted by the CDC and the Maryland Department of Health. And they're central to doing a couple of things: reducing disease and health burdens among people who use illicit drugs. 2 decades of research have demonstrated the effectiveness of these syringe services programs in preventing HIV, other bloodborne infections, and connecting drug users with a range of vital medical and social services and supports. And it's both of those things combined, both the infection prevention and the engagement and referral into treatment, that really make up the syringe services program. As I mentioned, we started this in November of 2020 in 2 neighborhoods, in Brooklyn Park and in Annapolis. And in that time, we've distributed just under 2,000 syringes, but just as critically have made 150 substance use disorder treatment referrals, 148 mental health treatment referrals, and more healthcare, housing, food, and infectious disease services referrals. And that's really the core of this program, is moving people along that continuum of care. We're going to talk about AA Power in a second. That is our street-based outreach and harm reduction. But between AA Power and our overdose response program, we've distributed in FY21 over 4,000 Narcan kits, 11,000 fentanyl testing strips, which allow people to know if there's fentanyl in their drugs so that they can take precautions to prevent overdose. Have trained over 4,000 individuals and have handed out wound kits over almost 1,500. I mentioned AA Power. That's our street-based, judgment-free, peer-delivered outreach team. AA Power started in late 2019. We've been carrying out harm reduction services since 2014. But we also knew that as time went along, we needed to be, as we've talked about with so many other things, we needed to be out in the community and providing those services. And so AA Power came out of that. AA Power is really focused on providing these range of harm reduction supplies, so overdose prevention, safer drug use kits, the safer injection assistance kits, infectious disease prevention, so things like safer sex items, testing for HIV and STIs, referrals to care, and then of course the syringe services program, as I mentioned. And no discussion of this would be complete without noting the work of the opioid intervention team, which is a countywide collaborative led by the health department, the Anne Arundel Office of Emergency Management, and the Annapolis City Office of Emergency Management jointly. And it brings together a range of agencies and actors from across the county and the city, not just in the health space, but also in the law, the prison system, social services, education, police, and public safety, and really looks at opioids, and actually looking a little bit broader at all substances now as we see the interconnectedness of these various substances, to look at a wide range of interventions to address our opioid and substance use issues. Pivoting a little bit to our crisis intervention teams, they focus on crisis stabilization to reduce hospitalizations, incarcerations, homelessness, and I think critically we should be really proud of the work that they've done. They were named the International Crisis Intervention Team of the Year in 2020, and that's a testament to what amazing work that's been going on for many years. Well, during the pandemic, the needs in our county have predictably increased. And we've seen between the warm line and the mobile crisis teams a 21 to 23% increase in volume over the year on year during this pandemic. We're talking a lot about the mental health effects of this pandemic. And one of the things we know is that during kind of the crisis times, people buckle down. While we've certainly seen issues around anxiety, depression, substance use, what happens is that as the crisis starts to wane, people relax a little bit from that fight or flight response, and then it really starts to hit them. And so the mental health impacts really come as the dangers from COVID, the virus, from a physical standpoint, start to go down. We'll start to see more and more mental health effects. from having lived through this pandemic. And the mental health agency, ourselves, service providers, we're aware of that. We're seeing the volume in our emergency departments in the hospitals. So one of the things we talk about is, well, what are we doing to prepare? And I think that's why I wanted to highlight that our mental health agency is second to none. We've been doing mental health first aid in this county, training on this for years. We've been doing critical incident stress management for years. This is exactly the kind of training that's needed to prepare us to respond to the mental health needs that we will have coming out of this pandemic. This is the core idea of prevention, is to be ready before the emergency happens. And we have been doing that. And I think that we are well positioned. There is going to definitely be a load in terms of the number of people needing help. And we are continuing to try to ramp up the number of people who are trained, but we have the infrastructure in place to respond. I'm going to pivot now to infectious diseases that are not COVID. And at this point, I'm just going to highlight a few programs. I just want to share that this is maybe just a quarter of the programs that we have. And I'm doing that more in the interest of time. You all have a larger set of information around the range of programs that we have at the health department. One thing that I did want to highlight was our HIV and STI prevention and care programs. This provides a range of programs around prevention, investigation, outreach to identify people who are at higher risk for HIV and hepatitis C and get them into treatment. Particularly our HIV/AIDS case management work. We have seen an increase in the acuity and the sickness level of the people who are engaged in that case management program. Concerningly, during the pandemic, we've seen a drop in the number of cases, and that's probably more a function of just fewer tests happening, particularly in the early months of the pandemic during the middle of 2020. And so we do expect to see more cases coming over the course of the next few months and years. I provided some data on numbers. I'm not going to read these to you, but I did want to make them available. Highlighting our chronic disease prevention, our breast and cervical cancer program continues to perform better than the state averages, and we're one of the, if not the best performing cancer prevention program operated through county health department and state. Critically, in addition to our breast and cervical cancer programs, we added a lung cancer program, and that just started this calendar year. And so we're looking to really push that out. Lung cancer screening funding is coming from the Cigarette Restitution Fund. And it's really a critical step as we make advances in the healthcare space around lung cancer, early screening and detection for lung cancer. This is going to be a critical part of our cancer prevention screening going forward. Along that line, our tobacco use and cancer prevention work. While screening is important, we also want to focus on the upstream of tobacco use and vaping and work to address and decrease those rates, particularly in younger folks, which is why our tobacco enforcement, while we did have to pause that for a period of about 5 or 6 months in 2020, those checks resumed in 2020, where we check with tobacco retailers to ensure that they are IDing folks who are coming in to buy. And as you can see, of the checks that were conducted, 87 retailers, so a little over 20% were issued first-time violations, and 30 of the retailers, so about 8%, were issued repeat compliance violations. This is really critical. We do need retailers to do those ID checks to prevent younger folks from buying tobacco products. Continuing the theme of preventive care, our Brooklyn Park Farmers Market and our Brooklyn Park Healthy Food Pantry are critical interventions in the north part of our county, where we know that there's a number of factors that come together, transportation issues, higher rates of poverty, less access to food. And so the combination of those two programs, along with a range of other community partners, are really critical to bring healthy foods to the community there. And there's also education and teaching done around nutrition, healthy cooking, I've been to one of those cooking programs. They're fantastic. I encourage you to take a look and a visit one day once we're fully back up and running. See a photo here of what a food pantry looks like during COVID. We've distributed in the past year over 98 tons of food, with 26% of it fresh produce. And I think a key part of our food pantry that needs noting is that it has a range of healthy proteins, including meats, dairy, eggs, fruits, and those are really the things that we want to get in people's hands. Pivoting to some of our family programs, our Healthy Start home visiting program continues to provide mental health, interpersonal violence prevention, substance use screening to high risk pregnant and postpartum women. This is a critical program for those families with either a pregnant, new to become mother, or newborn, to address the impact of substance abuse use in these families. 84 of 95 enrolled pregnant women resided in high-risk census tracts, and so this program is really targeted at getting those high-risk families. Our dental services, while we did have to pause briefly for COVID, of course, our dental services were able to resume. This is one of the effects of the COVID pandemic, is that our dental sealant program, a really pivotal prevention intervention that's done in 6 to 9-year-olds, had to be on hold in school closures. And we expect this to be a theme in the coming year, is the interruption of prevention services across the county that happened due to the COVID pandemic. Our REACH program, which provides access to low-cost primary, preventive, and specialty healthcare to uninsurable and low-income individuals, continued its work. A lot of its work it is done remotely anyway, but a bigger issue was, of course, access to care. Critically, about 5% of our REACH participants were impacted with significant health issues resulting from COVID, and some of them required long-term hospitalization. Our school health staff, as we've talked about, have been a critical part of our public health response. They also have their primary responsibility to our school children, and they provided a lot of support for consulting with AACPS to implement guidance from the CDC and MDH on how to come back into the school setting, and working through what those processes and procedures look like. We generally provide you with school health stats for the year. We do have some school health visits, mostly at our specialized schools prior to March, but March was when kids really en masse came back into school. And as you can see, their presence continues to be vital. One thing that I did want to highlight is our vision and hearing screening. We are one of the few counties in the state that continued our vision and hearing screening, even during the pandemic, despite the fact that you need to be in person to do this. And we thought it was critical to be able to do this, during the pandemic, so that we didn't have kids falling behind. We know that during Zoom class, things like your vision and hearing are still critical to your ability to learn. And then finishing up with our environmental health, our food safety facility inspections. During the pandemic, of course, these continued, and we continued a range of activities, including our rabies work. And I wanted to highlight this. We see that our rabies prevention work is critical. We've had a brief interruption in our vaccination program in 2012 and 2013, and we started to see the number of rabid animals increase, which led to our getting funding back. In 2020, we saw that there was 13 rabid animals, so a little bit of an increase over the past couple of years, with 10 of them being raccoons. And we continue to monitor this and monitor where we're providing vaccinations over the course of the year. And lastly, I want to finish up with the Bay Restoration Fund. Critical part of our prevention efforts is to improve the water quality in the Bay, reduce nutrient runoff. And in FY21, the department has almost $3.5 million of that 1.29 million has been allotted for sewer connections and best available technology installations for septic tanks. With that, I'm going to end this and open it up. Give me 1 second. Let me get out of this.
Thank you very much, Dr. Kellyanna Raman. I'm sure we will have plenty of questions. So would any of my colleagues like to start off? Mr. Volke.
Thank you, Madam Chair. Nathan Volke, District 3. Good morning, Dr. Kellyanna Raman. I wanted to go back to one of the slides that you were talking about, the AA Power slide. You indicated that that was sort of your street distribution for opioid intervention and helping people get clean materials. So one of the things that I know that you read about recently and that came up recently was the distribution of materials for people who were crack users, crack cocaine users, particularly crack pipes. They were being distributed. So I just wanted to understand from the health department's point of view, who approved that, who reviewed that, what was the thinking on that, what was the outreach that was done with the community, and what are you all doing at this point, and how much money did you spend on it?
Sure. Happy to answer that, Council Loki. So our AA Power program is, as I mentioned, is this street outreach portion of our harm reduction services. They've been operating since as I mentioned, since late 2019, and they've been providing a range of services since then. So referrals to treatment, overdose prevention has been a critical part of it, Narcan, the education, safer sex kits, infection prevention, and we work in partnership with Center for Harm Reduction at the Maryland Department of Health. Over time, we have added services based on feedback from the people we are serving, and we are in those communities in Brooklyn Park and Annapolis based on those communities' acceptance of us being there. So we do not go to neighborhoods where the community hasn't invited us to be a part of the service provision there. As we've been going along through 2020, syringe services, which are syringe services program, which, as I mentioned, there are 19 programs throughout the state and 9 counties. We applied to the Maryland Department of Health and were approved as a site. And we had conversations with communities about the syringe services with police, Anne Arundel County Police, Annapolis City Police, that this was going to happen. And with their understanding, approval, we began the syringe services delivery in those communities in, I believe, November. In November of 2020. As we were going along, one of the things we heard from the folks that we were serving is that some of them who were not injection users asked a question of, well, is there something that will help me? And we heard that repeatedly, more often in Annapolis than in Brooklyn Park. And so out of that came conversations with our power staff and our behavioral health staff, along with the Maryland Department of Health. And I'll note that the majority of syringe services programs also hand out safer smoking kits, including glass pipes. And the reason for that is that people who are inhaling, who don't have access to safer materials, use honestly whatever they find. So that can be cans, that can be plastic pipes, that can be metal pipes, and using steel wool as a filter. And one of the dangers from steel wool is that it gets burned, inhaled, and damages the lung. And so we see a lot of these injuries amongst people who are using inhalation drugs. Sores, cuts, burns that both have effects on their health, obviously just in and of themselves, but also have infectious disease transmission implications as well. So out of the conversations with the people who we were serving, and in concert with the Maryland Department of Health, our program made the decision to expand that. Now, we were already handing out safer smoking supplies, such as wound care kits, providing some of the rubber mouthpieces to prevent burning on the mouth. It was really the glass pipes that we hadn't distributed. We did that, as I mentioned, based on the request of the people using, that was in the beginning of April. We did that for a day before other community members had concerns about that, and by the end of day 2, we had stopped distribution of those. So, what came of that, was that the group of folks that we were serving had told us what they needed, and we were responding to that. What we didn't do was talk to all the others in the community specifically about the pipes, but they were and continue to be supportive of the range of harm reduction services and syringe services. In fact, we had a community meeting, I want to say about a week and a half after that story broke with the community, where they reiterated that they were in support of the full range of services being provided by AA Power, and had their concern was almost exclusively focused on the issue around glass pipes themselves. And I think one of the things that came out of that was that there's just less visibility on this issue of the dangers of inhalation drugs and what it looks like to prevent that. I think that we have had this public conversation around syringes and what their role is, and getting used to the idea of syringe services programs as an intervention. It's why Maryland passed it into law a number of years ago as a state-sponsored and supported funded program. But we haven't had as much of a conversation about the dangers of inhalational drugs, not just in terms of the drug itself, but in terms of the apparatus and the engagement into care. And so I think that part, yes, I agree, that part was missing, but I do want to note that that means that the people who need those services right now aren't getting that. Now, in terms of funding, the funding for this program comes, most of the funding comes from the state we are, as I mentioned, a state-approved syringe services program, and the Safer Smoking does fall under that category. Most of the funding comes from there, and the remainder of the funding comes from the CDC, from federal funding.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I'm going to stay on this topic because I have some questions. The slide that you showed for the needle exchange, I'm concerned with how we are presenting this program in the communities. The picture showed a young lady standing at a table handing out, I couldn't tell if the needles were readily available on the table, pre-packaged or not. But my concern is it looked like a table at a job fair or a carnival. And when we teach young children about the dangers of drug use, we also share the outside of overdosing, what dangers of needles are. And I'm concerned if we are going into communities with these very vibrant table setups that teenagers and young adults walk by, it sends a bit of a message that if you do start to use drugs, we can eliminate the dangers of needles by providing clean needles. I'm not saying the program should stop. What I'm concerned with is how we're presenting it within these communities. I think it would be better to almost set up kind of like a booth where you can have an opportunity to privately sit with a member of the Department of Health, but not have this table for all to see who walk by, including those who are vulnerable and young and may be curious when they see something like that. So if you can explain the setup within communities.
So the setup is that we are located in communities based on where the communities are okay with us being. The table is set up there so that people do have to come to us. We're not bringing this to people and saying, do you want this? Do you want this? But most of the information on the table is really around referral to services, referral to treatment, both from a substance use disorder standpoint, but also from medical, social services, overdose prevention, which is what you see mostly is the Narcan kits. We have the materials that we have that we distribute. They're actually not on the table just sitting out, but they are packaged in Ziploc bags and brown paper bags. There's nothing, probably the nicest way to say it, there's nothing particularly sexy about it. It is very utilitarian in its appearance. part of what we are trying to do is that in these communities that are hardest hit, we do want people to be aware that there are resources available for them. I think it's striking a balance between we want you to understand and know about this information versus we're not trying to glamorize it. And I've been through all the materials that we have. There's nothing glamorous about it. At least I don't think there's anything glamorous about it around the Ziploc bags. But we do want people to feel comfortable in approaching us. I know that there's a lot of conversation about children, but we are not handing this out to children. And frankly, we are really trying to be where there are adults and at times where there are adults there. We haven't encountered children coming by, to be quite honest. But I do think it bears noting that children in these communities are exposed to people using substances constantly. Our table is not their exposure to it. They are seeing this in their neighborhood. Our table is providing the resources to help people do that next step to get engaged in treatment.
Madam Chair, if I may ask a follow-up question.
I'll come back to you. Ms. Pickard?
Thank you, Madam Chair. Good morning, Allison Pickard, D2. Good morning, Dr. K. How are you? Thank you so much for that very detailed presentation about all the work that the health department does and has been doing over the last year. I know we have a lot of folks interested in this topic because it was, if it bleeds, it leads. It made the headlines of the paper. I'm concerned that we're taking this down a path that's not healthy for our community. We have so many people suffering from addiction, and figuring out how we treat addiction and speak about addiction as a disease, just like you would be talking to or addressing someone who's insulin dependent. We're working really hard to break the stigma of mental health issues, but addiction still seems to be, we still seem to be clutching our pearls about addiction out here. And I'm conscious of the way this conversation is going. The Just Say No campaign of the 1980s doesn't really get us anywhere when we have a massive opioid addiction issue across the country, not just here in Anne Arundel County. I'm curious how you think, or how the health department feels we can continue and highlight that stigma around addiction in a similar way that we do mental health. It's taken us a long time to get to the conversation around stigma and mental health. Addiction, we're still struggling with. I really do. I have some other questions about other aspects of your work, but I gather we should finish this one up so we can move on. Thank you, sir.
Thank you, Councilwoman. So I think the issue of stigma is a really critical one, and I'm glad you mentioned that. We talk a lot about anti-stigma, both in terms of mental health issues around depression and anxiety, but also in substance use. And it has been a harder nut to crack in terms of decreasing stigma around substance use disorder. I think part of that is being honest about the toll that it's taking on us. And I certainly see progress on that front in terms of not just talking about it, but talking about the people who are using drugs in respectful manners, trying not to use the words like addict or clean. In fact, our opioid intervention team just had a presentation on this exact issue around the language that we use. And I think that we're trying to do the same thing in terms of these harm reduction services, is to say, and to strike that balance, as Councilwoman Fiedler noted, between saying, this service is available. It's a neutral service. If you need it, we're here. And if you don't need it, good, we're glad. But to make it available, particularly in those communities hardest hit, but honestly, to make services like this available wherever people need help, I think is really part of the issue we need to do to address stigma and to recognize that this issue around drug use is happening throughout the county. It's not limited to these two neighborhoods by any stretch of the imagination. And when we look at a map of our overdoses, it's tracking along the entire county. So I think that as we talk about this, we want to be sure that we're really looking at why we're doing these programs, how we're doing them, and how we can improve them to best serve the folks that we're trying to help.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Dr. K, thank you so much for the presentation. Along these topics, I'm trying to understand more of the procedural side of things. And so you mentioned that when this specific program, or when the pipes were added, you said our program decided. And so I guess I have two questions really based off of that. Number one, when you say our program, who is it that signs off on this? Is it you? Is it someone else? You know, is it a group decision? If so, who's involved in it? And then what alternatives were considered in this instance, if any? And in any instance, when you go to look at some of these harm reduction strategies, what alternatives are you considering, if any?
I'm just ready to think. Give me 1 second. So in terms of our program, so our programs operate in pretty much like every other agency. The larger push around syringe services programs and its launch, myself and other leadership at the health department were aware. Certainly others in the county leadership were aware of that. The specific details, the implementation details, those are worked out with communities. And I mentioned that the communities that we are in doing AA-powered street-based outreach, those communities were involved and invited us to be there. So that they're a key part of that decision-making process. And we also discussed this with the police both for Anne Arundel County and for Annapolis City. There's always going to be tweaks in that program. And we empower our programs to make those small changes, right? When they decided that they now have the ability to add fentanyl test strips, they're going to go ahead and do that. That's a part of harm reduction services. That's a intervention supported by the Maryland Department of Health. When we can add additional treatment referrals, they're going to do that. When they add the safer smoking kits general without the pipes, they made those changes. Those didn't register on anybody's front page. It's really the pipe, and the pipe alone is the only thing that registered on anybody's page. And they made that decision as a technical decision, just as they would with any others, and based on the requests of the people who we were serving. And I think that's really the critical part of this, is that we try to be really responsive to the people that we're serving, particularly as we're doing these substance use disorder services. And when we talk about decreasing stigma, when people say, hey, what about helping me? We say, yeah, you know what about that? And so the program was empowered to make that decision. I take full responsibility for that. I'm not trying to pass the buck, but that is fully within their purview and was done in partnership with the Maryland Department of Health. So it's a part of normal programs. And in fact, other programs around the state have implemented not just safer smoking kits, but pipes without any of the kind of large amount of press that we've gotten around that. The second question you asked about what alternatives there are, interestingly, I think that I'm glad you asked that question, because really there wasn't any alternative for those folks who were serving who were using inhalational drugs, right? We had the syringes, and what we heard from those folks who were using was, I don't inject, I'm getting all these cuts and burns. Do you have anything for me? And that was really the impetus to say, okay, what interventions do we have for people using inhalational drugs? And based on not just the Maryland Department of Health, but programs across the country that are doing this, this was where we ended up.
Thank you.
Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. So I don't know if this is much of a question as it is a comment, just to put some of this in perspective, because a lot of the controversy has occurred in District 6 in the city of Annapolis. So to just add a little context here, I'm not tracking on a daily basis the number of overdose deaths in our county. I'll tell you, the weekend before Mother's Day, there were at least 6 in a single weekend in Annapolis. And I got a call from a constituent devastated because she knew at least one of them. She was connected to others who were trying to find different opportunities to, different ways to help people to provide some sort of interventions, to provide Narcan to help people so they wouldn't, so they, so their overdoses wouldn't be fatal, they could be reversed. So I'm actually very grateful that the health department has taken this this step, and I don't even want to call it a bold step, because this is not new. It may be new to us. It may be something that hasn't happened in Anne Arundel County before, but this has been used in places all over the country, including the safer smoking kits. And so I really appreciate the fact that you're responsive. As a, I imagine, I try to put my shoes in the perspective of different people in different communities. And I imagine, you mentioned, how does this look? What do children think about this? Children in communities that are impacted by substance abuse know exactly what it looks like. They know what someone who is, under the influence looks like. They see the materials that that people that are using different substances use. So to have someone there from the county health department setting up with a tent and saying, we are here to help. We are here to provide you referrals. We are here to provide different materials to make sure that you stay safe if you are not ready to, get a referral to some sort of treatment. I just really want to applaud you for being, again, I don't want to say bold, but for just taking this step that was requested by members of the community. I feel like that's exactly what we should be doing. And I hope that you continue to do it, even though outside of the immediate community, there was pushback and resistance. When it comes down to it, it's the folks that are most directly affected that we should be worried about. And my understanding is that there's a fair amount of research that when groups like AA Power are able to connect and build trust with the communities that they serve, ultimately, they are the same groups that individuals will turn to when they finally say, I am ready for treatment. I am ready to break the cycle that I'm in. And so building that trust is a key step. It may look weird. It may look weird to an outsider that's not, familiar with that, with that aspect of building trust. But, saving people from other infectious diseases like HIV and Hep C is really important. And really, to be honest, the glass pipes are the same. It's in the exact same vein as the syringe exchange. It's providing someone a material or an item that will keep them safe and protect them from those other, those other outcomes. And so I just want to say thank you, because you are you are seen as a positive light in the community, not something to be shunned. And maybe that wouldn't be seen in every community that way. But again, you came there because the communities wanted you to be there. I guess I actually do have a question related to this. So I'll wrap it up with that, since I just, sort of wanted to express what I was hearing directly from constituents. Is what other, I know obviously opioids has been front and center, and fentanyl in particular, and carfentanil has been front and center, but what other substances are you seeing out there? Obviously, I think one thing that alarmed people was, well, we don't really have a crack problem. Why are we putting out safer smoking kits? Well, clearly we do have a crack problem. It may not be as big, but what other substances are you seeing out there, and what proportion do they make of the concerns that you have?
So we are seeing, thank you for that, Councilwoman Rodriguez. We are seeing a range of substances, particularly xylazine. So we're not seeing as much carfentanil anymore. I think its lethality, it was so lethal that it actually got pulled. But we're seeing xylazine, which is a veterinary anesthetic, being mixed into drugs and pretty much all drugs at this point. And one of the challenges with it is that it's an anesthetic, so it does cause people to lose consciousness, have respiratory depression, so lower breathing, but it is not an opioid, so it doesn't respond to naloxone. And so people who are overdosing, but when others, whether in the community or first responders, are coming and giving Narcan, they are not responding to the Narcan in the same way, because the Narcan can only reverse the opioid piece of it. And that's really scary, and that's been increasing in as a percentage of the drugs we're seeing in people's systems who do overdose. And so we've got a lot of concern around that. We're also seeing stimulant use increase, and also increasing cocaine and crack use as well. So we're starting to see shifting patterns of drug use. I think the other thing to note is that heroin, as we know it, is almost non-existent in the community. Pretty much everything that we called heroin is now fentanyl. We see over the past 3 years, we've seen a progression of, a decrease in the amount of heroin showing up in overdoses, and it's close to zero at this point. Fentanyl is not only the heroin substitute at this point, but fentanyl is also showing up in other drugs as well. And that's part of why our opioid intervention team is making sure that we're not focusing just on opioids, but on other substances as well, because they do, people use multiple substances, but also individual substances are adulterated with other substances. And so it's hard to talk about one particular drug abuse.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. I see Councilwoman Fiedler has her flag up. I know she had follow-ups on this topic. I actually want to talk about a different topic. So if it's possible, I'm happy to step back, let her ask her questions, and then go.
Go ahead, Mr. Volkey.
Oh, thank you, Madam Chair. Nathan Volkey, District 3. You want me to go ahead and change the topic?
I don't have to call you again. Why don't you ask your question, please?
Sure. So Doctor, question for you about communications that you've had with TAC, which is, I think you know, the Teachers Association for Anne Arundel County. So at the federal level, there has been some coverage of communications between the federal teachers unions and the CDC relating to guidelines on students returning to schools. What, if any, communications have you had or other members of your staff had with TAC in terms of opening schools, guidance that's been issued, and basically how to get kids back into schools?
So I've had a few conversations with TAC. I'm trying to think, maybe 3 or 4 conversations over the course of the pandemic. My conversations with the folks at TAC have been around, what the guidelines are, how to interpret them. I'm thinking, you'll forgive me, but my dates are a little fuzzy. I believe my conversations with them probably were August, September, first time. But I would have to check my notes to confirm that. But really talking about the guidelines. So the Maryland Department of Health, as we may remember, I think it was in late August, came out with a set of guidelines, and we in the county were working on providing some greater detail and fleshing that out. And they were one of the groups, we worked with a number of groups actually, to get their feedback and input on that. Had some other conversations with them around CDC guidelines, particularly when CDC guidelines were updated, thinking in January, about what that means, the implications. Those are really the conversations I had with TAC.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So I'd like to, if we could, go back to the discussion on addiction and numbers in our county. I think Ms. Rodvian touched on the overdoses to date. So just looking in the available data, if I'm reading it correctly, we're pacing for another year of increased overdoses. For instance, to date comparatively, in 2017, we had 155, 2018, 150, 2019, 100, 2020 was 120, and as of today, not even in June yet, we are at 83. Looking at fatal overdoses, in 2017, we had 15, 2018, we had 30, 2019 was 18, 2020 was 19, and 2021, we are pacing already at 45. But then looking at safe station visits, those are down. The first year we tracked it in 2019, we had 1,090 visits. 2020, we had 1,264. This year, we only have 336. So I'm concerned by these numbers. To me, it indicates we may have some barriers in service. I know the state has an opioid response initiative. So I'm trying to identify how many beds we have countywide and if we have barriers to filling those beds. And I'll give you an example. I understand that the Pascal Crisis Center can only accept 5 self-referrals, but have the capacity to accept 16 to 20. And in doing that, we have the potential of sending someone who is seeking treatment to kind of go through a loop, like a roundabout process to end up in the same place. And as you know from working in mental health and with the professionals in the arena, every second that someone has a hand extended and is asking for help, and that help and that response is delayed, or they have to go through a bunch of hoops to get that service, it's another opportunity for someone to relapse, walk away, decide it's not worth it. And that risks their lives. That puts, them at risk. So what is the Department of Health doing to remove barriers and make it easier to get in a bed immediately when you ask for help?
Thank you, Councilwoman Fiedler. So I'm gonna start, and I'm gonna ask Sandy O'Neill to join us, who can shed a little bit more light about the process of how people are matched to beds. One of I think the most important thing about our system is that we do sometimes struggle with getting folks into a bed because all of the beds are available to anybody in the state, and we certainly run into that issue where people from other counties are receiving services in our county, and folks in our county have to go to other places, other counties to receive services. Unfortunately, there really isn't a way around that issue because these are either state or federally funded programs, and we can't put residency restrictions into place. In terms of the numbers that we're seeing, what we're seeing right now is that this year, we're kind of tracking pretty closely to last year. I know we got, unfortunately, a larger number of overdoses in the first few months of this year. That pace has slowed down a touch so that at this point, we're almost exactly at where we were last year, which is a tick up from the year prior. So I don't mean to dismiss what's happening, just to provide it in context. But I do want to turn it over to Sandy O'Neill to talk a little bit more about the process of how people who do need services can engage in them and what happens through that.
Sure, and thank you for that and this opportunity. So as I'm sure you're aware, it's very complicated. The entire system is very complicated. One of the things that we did was to create in our county this pathway for what we call crisis stabilization beds for substance use disorders. Right now in the county, we have about 30 to 32 beds available at any given time. And the purpose for these beds is for those people who can't get directly into treatment as quickly as they want to. So this is a place, sometimes our inpatient providers are full. So the crisis stabilization is a place, a safe place for individuals who are ready for treatment that don't have someplace else to go, can go and get started on that treatment. And it is a very important resource in the county that we have. So we are, always looking at what the system needs and what the demands are. And we just see the demand for treatment ebb and flow. Some of our providers take referrals from everywhere. So we get referrals from the hospital. The referrals come in from people walking in requesting services. It comes from safe stations. It really is an open door for people who are interested in getting treatment.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. So another topic that I wanted to ask you about is the current state of the COVID-19 pandemic, and really looking at the numbers from the health dashboard and where we stand today. Is it your opinion that we still are in an emergency situation where it is justified that we need emergency power for the county executive because of the exigency of the health situation and the need for possible changes very quickly.
Thank you, Councilman Boki. Yes, I do believe we are still in a public health emergency, and that we are, as we see our hospitalizations coming down, they have not, nor will they, unfortunately, at this point, go to zero given the level of community spread. Our vaccination efforts throughout the county across a range of providers is meant to continue to push that down. I think what we're seeing in terms of variant spread is deeply concerning. What we see from other states and other countries is that we're not quite out of the woods. We're in a lot better shape. I will take where we are, but to stop now and would be a mistake. It would be a mistake because it would essentially stop short of where we need to push to, which is to get those vaccinations into, as I mentioned earlier, 80% of the folks, at least 80% of the folks in the county, so that we really stop spread and get back to a place where we are able to operate our lives the way we usually do.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. This is a follow-up to my previous question. So I'll give you an example within the community. A family member of someone who was seeking services, and this is how this came to my attention, was very frustrated that that family member went to a crisis stabilization center, the Pascal Center over in Annapolis, and was not able to get a self-referral bed because of the 20 beds that they have, they are only allotted 5 for self-referrals. And this person, in a moment of crisis, seeking services, had to leave the center for which they ultimately were trying to get to go to a safe station, to then be referred through other measures to end up in it. So we're adding time for someone in crisis, transportation for someone in crisis, when the bed was literally in front of them. So how can we make it so that the requested ability to use all of the beds available at our crisis stabilization centers for self-referrals? How do we get there? Because I think that we are really rolling the dice on people continuing through with their requests for assistance and increasing the potential for relapse.
So you're right. Those kind of barriers are counterproductive. I'm going to ask Sandy to come back because she is neck deep in this particular. We talked a lot about this particular issue. How do we get the right bed to the right person at the right time?
Mm-hmm.
And turn it over to you, Sandy.
Sure. Thank you. And thank you for that question, Councilwoman. I think that, I would like to think that that was an exception that happened, and we have created as many pathways as possible for people to get to these beds. Literally right next door to that particular facility, there's one with a 24/7 walk-in, and we have put as many safety measures in place, or kind of contingency plans in place, so that if somebody shows up needing services, that they can get them. So I would be hopeful, and I'm more than willing to talk to that provider to figure out, what can be done to prevent something like that from occurring again. But we do have mechanisms in place as much as possible. So I'm not sure that entirely answers your question, but we absolutely work on it, trying to get people the right place at the right time when they want it is always a challenge, and something we are continually struggling to do.
Ms. Radvian?
Thank you, Madam Chair. Lisa Radvian, District 6. Gosh, I have a whole list of questions, so I won't ask them all. Some of them I'll just wait for later. But I was just curious. I have some questions about gun violence, because we've had some issues with that. And so I was just curious if you could just tell me who is leading the gun violence intervention team. And then I have a related question, if that's all right, Madam Chair.
Well, other council members have combined their questions so that they get 3 in 1. If it's very closely related, please go ahead. I know you have to leave, but I do want to keep going around rapidly here so everyone's questions can be answered.
So the health department is leading that multi-agency gun violence intervention team work, and we have as part of that group folks from Johns Hopkins from the Gun Policy Research Center as well, who provide technical support on evidence-based practices that do help reduce gun violence.
Is there a particular point of contact that if I wanted to reach out, you?
You can reach out to me and I will connect you with our gun violence team.
Okay, thank you. I'll leave it at that. I'll send my other questions via email.
Thank you. Ms. Hare?
Thank you, Madam Chair. Jessica Hare, District 7. Dr. Kay, I wanted to touch on this healthy food pantry that you've got going to Brooklyn Park. When you first came to the county and we spoke, you and I had discussed privately sort of the need for, I think that's a great program that you all are doing, but we had discussed that there are parts of District 7 and I'm sure other parts of the county that could benefit from very similar programs. There are some schools in District 7 where more than I think 40% of the kids are on free and reduced meals and things like that. And we have similar kind of food deserts. And so now we're, I guess, 2.5 years in, and I'm curious if there's been any efforts to expand. I recognize that there have been lots of efforts during COVID, but that are totally sort of separately related to COVID. And so I'm more specifically looking for permanent program expansion and whether there's been any.
Yeah, I do recall our conversations around that. I think that just to be honest about it, I think that permanent expansion just wasn't really an option in the middle of the COVID pandemic. So it was really focused on temporary expansion of food assistance. But I think that's a great question. It's something that we continue to be focused on, and particularly with our healthy eating, active living group with the Healthy and Arundel. I think that's exactly the kind of topic that we wanna get at. And so I'd love to follow up with you separately to talk about who in the community we can talk to about this and really push on this particular issue in South County. So I'll follow up with you afterwards.
Great, thank you.
Mr. Volkey?
Thank you, Madam Chair. Nathan Volkey, District 3. So, Doctor, I want to circle back to the COVID questions that I was asking you. So again, looking at the health dashboard that you all have on the health department's website, I mean, I'm noting on the hospitalizations that they're about where they were during the summer. The total case rates are down. They're close to where they were, last year at certain points. When is it that you're going to feel from a health standpoint that this is no longer an emergency situation and that emergency powers are no longer warranted? I've been asking that question for, I think, 14 months now. But at what point do we get to a place where we say, okay, this is sort of something that we have to deal with like other viruses that we know about? When do we get there?
So, Councilman, where we are right now, as I mentioned, we're obviously in much better condition. This is exactly what we have been pushing to get towards. We need to continue to vaccinate, and we need to continue to see the vaccination numbers increase. One of our biggest challenges, to be quite honest, is that we don't have an approved vaccine for kids below 12. Today, literally today, the CDC, the Advisory Committee on Immunization Practices, is likely to recommend the COVID vaccine for 12 to 15-year-olds. So I'm going to operate under that assumption. That's a key hole in our public health strategy, and it's not one that we can remedy ourselves, right? That requires the pharmaceutical companies to complete those trials. Our goal is this is an endemic virus. So we talked about a pandemic, pandemic being multiple epidemics across the globe. This is now an endemic virus. It's a virus that is going to be with us. We're not going to eradicate it. We're not going to be able to contain it. And so I think your question is getting to that core issue of when does it from a public health standpoint go from being something that's an emergency to being something that's chronic? Well, we're in that transition space right now. We're being helped by the fact that there's a reason we talk about cold and flu season. Is that during the winter months, fall and winter months, low temperatures and low humidity provide essentially the environment that the virus is spread along. You noted that our hospitalizations and our case rates are coming down. We saw a similar pattern last summer, right? where we saw fewer cases, and we're seeing that now. What we're trying to do is get ourselves set up so that we do not essentially face that same unbelievable pressure on our healthcare system in the fall and the winter. To your legal question of emergency powers, I apologize, but I can't answer that question. I can only tell you about the public health nature of that.
Ms. Fiedler?
Thank you, Madam Chair. Amanda Fiedler, District 5. I just want to start off with thanking Ms. O'Neill and Dr. Kalyana Raman for willingness to have discussions on how we can better serve our folks who are struggling. My question, I'm going to stay in the COVID arena. So Dr. K, I appreciate that you answered some of my question on athletic events and the school system. And I know that the school system ultimately makes the decision, but if I understand the CDC website correctly, the CDC considers safer gatherings those that are outdoors, and that being 6 feet apart does not necessitate a mask. What I'm hearing from parents who are attending athletic functions is that they must wear a mask outdoors, regardless of how close they are to others. And I've gotten videos of parents watching their kids, and they do the panoramic and there's nobody around them, but they are required to wear a mask. So my question is, what has your specific recommendation been to the school system as far as outdoor athletic events?
Thank you, Councilwoman. So our conversations with the school system are really focused on how do we apply the existing guidelines. So I had mentioned to you that we don't have any restrictions in the county that are beyond what the state has set out, or that the CDC has recommended. So our conversation is really focused on how do you implement those guidelines, and then it's up to whether it's AACPS or frankly any of the other organizations or businesses that we provide advice to. It's up to them to apply that. And so we've been consistent in our messaging, not just with AACPS but with everybody else, that for outdoor events, for vaccinated individuals, there's a lot. The guidelines suggest that outside of crowded events, you can be unmasked. For unvaccinated individuals, though, the guideline is a bit more restrictive in terms of, yes, you can be outdoors without a mask, but once essentially the density or the number of people in a particular space starts to rise, and that's really what the guideline is, and we can go through detail by detail, then you should mask and distance. And I think that the challenge that ACPS and everybody has is that there's no real system right now to verify who's vaccinated, who's not vaccinated. Right. And we're seeing this across a range of organizations as they're trying to figure out how to apply a consistent set of rules where people self-identify as either vaccinated or unvaccinated. I think that's the challenge that we're seeing in this space, particularly when we're talking about athletics and spectatorship, is how do you have a guideline that's one size fits all when there's actually two pathways for vaccinated and unvaccinated folks? So that's been our conversations with them. And just to be candid, it's up to them to figure out how they can implement that. We don't really get into the nitty-gritty details of that. If they have questions, they ask us. But beyond that, we're not telling them this is what you got to do. This is how you lay it out. We'd probably never make it out of our email inboxes if we tried to do that.
Ms. Pickard.
Thank you, Madam Chair. Allison Pickard, D2. Good morning again. I have a middle schooler up here in the Glen Burnie cluster and a high schooler in the Broadneck cluster. And I'm just curious if, I know the health department is involved with all the contact tracing. I know my high schooler, we get a letter almost daily about cases coming out of Broadneck High School. I know you can't tell us specifically, but I know we've sort of been going on this understanding that children and youth are not necessarily getting the same level of symptoms and things, but are we seeing the age of hospitalizations and folks that are really ill? Are we seeing that age come down? I know while it's been disruptive to the student population at the high school, I would like to understand if we're seeing our young adults getting really ill from COVID. I know that's probably too much for you to answer.
No, yeah, I'm happy to, Councilwoman. Well, we are definitely seeing decrease in the average age of hospitalization, um, down into the 20s, 30s, 40s. That's different than what was happening earlier. We definitely still see some hospitalizations in the under 20 group, but that's far less. That's typically in kids with some underlying condition. We do see, however, that there are a handful of cases of the MISC, the multi-system inflammatory disease that is found in children. We've had a few children who are residents of the county who have had that. And that actually is a bit more, it's a bit more unclear as to who develops that and why. And it's not clear how much even symptom severity predicts that. So we've seen people with pretty mild cases of COVID, or children with mild cases of COVID who've gone on to develop that syndrome. So it still does happen. It's also one of the things that, you know, we don't talk much about, but certainly when it happens to that child and that family is pretty scary. Luckily, all of those children have recovered with supportive care.
Mr. Volkey.
Madam Chair, Nathan Volkey, District 3. Doctor, where do you all stand between supply and demand of the vaccine? So I know that I asked you the question about when you go from pandemic to, as you called it, endemic, and it's something that we're dealing with as chronic. And Councilwoman Hare reminded me that I think at a previous meeting, you may have mentioned to her that when we get to 60 to 80% vaccination is where you think that transition may really start to stick or be appropriate. So where are we in terms of the number of people seeking the vaccine and the supply of the vaccine? Is that still a problem? That's been a problem, I know, for a while. I just am trying to understand, you know, are we going to get to that 60 to 80%, or are people going to say they don't want it? That's what I'm trying to understand is with this question.
Yeah. Thank you, Councilman. So I'm going to toggle between two numbers, so bear with me for a second. So 47% of, or 47, 48% of people, so 0 all the way through 100 something, have gotten at least one dose. But we've, from an operational, so that's important for our population, the dynamics of viral spread. From a vaccination standpoint, because the vaccine was only approved for 16 and up, we have focused operationally on what percentage of 18 years old and older have gotten the vaccine, because they were the ones who could get it. Operationally, we are at about 61, 62% of adults have gotten a first dose. About 2 weeks ago, we started to see that demand started to drop. And it was pretty sudden. So we were planning that somewhere in the 50, 60% of adults, because it's an operational question, that we would start to see a slowdown in our vaccine delivery because of decreasing demand. And sure enough, right on mark, we started to see that somewhere around 55% of adults a couple of weeks ago. And that trend is going on across the state, where there's a lot more supply than there is demand. At this point, I can tell you that our health department clinics, we are seeing probably about 30% of our appointment slots are being filled. So we're in the process of shifting from a larger mass vaccination kind of approach to a much smaller distributed clinic approach. And we've already started that transition. That happened with our community vaccination clinics, our homebound, our vulnerable populations. And we knew that as our volume went down on our mass sites, we would pivot it to more and more community sites. So we're doing that right now. It's why we're opening up in the Annapolis Mall with the library, and we're looking at other partnerships throughout the county.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. Dr. K, I'm hoping you can help share information for parents who are interested in getting their children ages 12 plus vaccinated, because I've had a few constituents reach out and they are having some challenges finding information on when it's going to roll out, how it's going to roll out, where they can. So all the questions you can imagine are coming in with this population are coming in.
Yep. So we're essentially planning tomorrow, Councilwoman, to open it up to 12 to 15. The key technical issue is that our appointments are made in the state's prep mod system. That's essentially just our vaccine appointment system. And they have to enable that system to take 12 to 15-year-olds. There's hard age cutoffs in there so that we don't inadvertently vaccinate somebody who is too young. So they are scheduled to make that technical change today as soon as the CDC makes their recommendation. As soon as that happens, parents can register their kids and we're ready to start vaccinating them tomorrow. So I know that folks are eager. I would suggest that you visit our website starting tomorrow or even potentially tonight. It just depends on when that switch gets flipped. And then we're off to the races.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. So, Doctor, one more question. Just the two numbers that you'd given, I understand the distinction, the operational versus the actual. So now that the operational is expanding, I guess when I had mentioned that 60 to 80% number that it sounds like at some point previously you'd said, you know, that was kind of the threshold you were trying to get to. Is that a 60 to 80% reference to the entire population, or is that 60 to 80% of the operational population, the 18 and up population, 16 and up? Who is it that we're talking about there when we use that number?
Yeah, so so the operational side has to do with vaccinating, and the population side has to do with viral spread. So you can think of the end state is once every single person is eligible, those two come together. Those two numbers come together because the operational is the same as the population. So right now, from a public health viral spread standpoint, we're still at 47%. From an operational standpoint, we're at about 62% of adults. And then as the age goes down, we'll drop, right? Because those 12 to 15-year-olds haven't had an opportunity yet, but they're going to get it. And we're following along with public sentiment as to, you know, what percentage of parents are planning on getting their kids vaccinated or not. But that 60 to 80% has to do with the dynamics of vaccine uptake in a population. So the 50% of the folks who were rushing out the gate to get their vaccine are very different from the 50% who did not do it, right? And so the amount of effort we had to spend up front was to try to make sure that it was an equitable system, that it wasn't first come, first serve, because that would bypass a lot of people who had much higher need. The second half of our vaccination effort is largely a persuasion and outreach and engagement to try to pull people in. So, you know, unfortunately, initially we had to slow people down because of supply. Now we're having to draw people in. And it's that 60 to 80% where you have to put in a lot of effort to get from 60% of a particular group vaccinated to 80%. You have to put in a lot of effort. But that effort is really needed because that's what's going to get us to population immunity. And that's what's going to help us pivot really out of this being the emergency that it is to a much more sustainable pathway. So that number, and I apologize, I wish I was a little bit clearer about this, but that number that I'm quoting is for adults only. And we're going to have to look at that for the 12 to 17-year-old crowd, right? As to, okay, well, what's our uptake in that age range? And I did include an age range in that, and we are going to be including that on our vaccine dashboard so that we can see what those differences are among the ages and where that uptake is. I hope that answered your question.
Mr. Volkey, do you have another question?
I do. Thank you, Madam Chair. Nathan Volkey, District 3. So, Doctor, just to follow up on that, what I think I'm hearing you say, and I don't want to misunderstand or misquote, is that really it's a 60% of the whole population. That's what you're looking at. Like, you don't want to just limit it to the operational population of 18 and up or 16 and up. You're saying you really need the whole community to be at about 60% to 80% vaccinated before you feel like we will be out of this in terms of an emergency situation.
close, Councilman. We need 70, probably closer to 80% of people to get vaccinated to be to be able to truly get to population immunity. The 60 to 80% is where we also see that it's the hardest to get from 60% vaccinated to 80% and requires a much larger incremental amount of effort to get from point A to point B, 60% to 80%. So there's kind of two different bands that they have the same numbers, but they also have different meanings.
Mr. Volkey?
Thank you, Madam Chair. Nathan Volkey, District 3. One additional follow-up as we're kind of moving into that number. So have you had any discussions with the school system about whether they will require that children be vaccinated to be allowed to come back for in-person schooling?
Thank you, Councilman. So we have not had that conversation with them yet, but I know that discussion, kind of the general discussion around vaccines and requirements is definitely circulating, and we've seen some higher education institutions put in requirements around that.
Ms. Fiedler?
Thank you, Madam Chair. Amanda Feather, District 5. I'm going to dovetail on Mr. Volkey's question. So if we do not get to 60, 80% because interest or willingness to get vaccinated comes to an end, everybody who wants to get vaccinated is vaccinated, eligible for vaccination is vaccinated. Is that a point at which we'll say, okay, everyone who had an opportunity to be vaccinated is vaccinated. We can't force folks to get vaccinated. So this is where we are, and we need to move forward now.
Yeah, Councilwoman. So yeah, our goal is really closer to that 80% to get folks vaccinated, and I think that will put us in a very difficult kind of limbo, which is that we're doing well enough, but not as good as we need to be. And what that means is we've had conversations with our hospital partners about this. Is what are you starting to think about in terms of your COVID volume during cold and flu season, right? This past year, they've had virtually no flu admissions because of distancing and masking. And so even despite not having flu admissions, the COVID spikes were taxing their systems, were forcing delays in care. They're looking at what their projections are in terms of what is their COVID census during cold and flu season, and then what is the flu on top of that? That's the limbo, right? If we can't get to population immunity, then it makes it much harder to understand, are the hospitals going to be able to weather that storm or not? And I don't know the answer for that. I just don't. But that's what we're trying to get out of, is to get to a place where we do have a better sense of the answer. Is we got enough people vaccinated, we're in a much better position. So I'm sorry that I can't fully answer that, but that's the uncertainty of not getting to herd population immunity, is we're not quite sure what the dynamics will look like.
Does anyone else have any other questions while we sit as the Board of Health? I know we all know how to reach you, Dr. Kellyanne Rahman. Many thanks to you and all of your team. It's certainly been more than extraordinary year that we hope never to have to repeat. So thank you all for the much extreme degree of effort that you all went to try to keep the county safe and in better health. I know that our next topic is going into the operating and capital budget review, but I think we could all use a break. So I'm going to ask for a motion to take a approximately 10-minute recess until 11 o'clock. Is there a motion to recess?
Motion to recess, Allison Pickard.
Is there a second?
Second.
All in favor say aye.
Aye.
Aye. Any opposed? Hearing none, the council is in recess until 11 o'clock a.m. Thank you. Madam Secretary,
Yes, Madam Chair.
when you're ready, please call the roll.
Okay, I think we do have some council members who are jumping off and coming back here. So let's see what we can come up with. Again, beginning with you, Miss Lacy,
Present.
Miss Pickard,
Present.
Mr. Volkey,
Present.
Mr. Pruski. I believe Mr. Pruski will rejoin us shortly. Miss Fiedler,
Present.
Miss Rodvian. Same for Miss Rodvian. Miss Hare. And I do believe Miss Hare had to jump off for a break as well. Michelle Beaulieu, our county auditor.
Present.
Madam Chair, we have enough council present to proceed. I believe other council members are coming and going as the afternoon unfolds.
Thank you, Madam Secretary. Okay, so we will move on to the budget presentations, and we're going to start out with the Health Department doing its operating and capital budget. All presenters, please remember to introduce yourself and continue to identify yourself before speaking each time. Dr. Kalyana Raman and Ms. Penley, good to see you. And you have the floor.
Thank you, Chairwoman. I am Dr. Kalyana Raman, the Health Officer for Anne Arundel County, and having had the opportunity to talk to you for the past couple of hours, I'm going to just pass it on to our Chief Financial Officer, Billy Penley, to take us through our budget.
Good morning, Council Chairwoman Lacey and members of the council. For the record, I am Billy Penley, the Health Department's Chief Financial Officer. We are pleased to be here with you this morning to present to you our operating and capital budgets. With that said, let's please get started. In your operating budget book, please turn to page 244. On page 244, this presents to you the Health Department's FY22 proposed operating budget at a high level. On this page, you will see our request for FY22 is 77.7 million. This is approximately 10.7 or 16% more than our FY21 budget. The increase is primarily comprised of grants, ARPA funds, in the amount of 9.5 million and 1.3 in county funds. This is broken out percentage-wise by 55% county funds and 45% from grants. The highlights of our budgets for FY22 include 13.5 million for our public health emergent pathogens response program, also known as COVID. 306,000 for the second installment of the school health contractual employee pay equity adjustment. 60,000 for our food protection services software upgrades, reporting, inspections that our Environmental Health Bureau uses. 16,000 for temporary secretary support for the rodent control program that's seasonal when that program is active. 2.1 million to funding to our partner agency, the Anne Arundel County Mental Health Agency. A good portion of that funding is ARPA funding. One component is 1.1 million to support the growth of their services. Another 715,000 for their behavioral health temporary alternative shelter program, and 293,000 in county funds for 6.5 crisis intervention team positions. We have 125,000 in our budget this year for enhancement of our social media campaigns. And also our budget recognizes increases for county employee pay packages. We're here to answer any questions you may have on the operating budget.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. Ms. Penley, about one of the last things you mentioned, the 125 for social media campaigns. How much of that is going to be directed toward what Dr. Kalyana Raman was mentioning earlier in terms of trying to move the needle on vaccinations and trying to persuade people to be vaccinated?
I'm going to defer
the answer. I'm just going to give you some numbers of what our website activity is, and then I'm going to defer back to Dr. Kalyana for those details. But the activity on our website has quadrupled from 621,000 in FY20 to over 2.4 million in FY21, which is a record high from 1998. With that activity and our experiences this past year in trying to get out information fast and furious related to COVID, we felt the need, it was time to do some upgrades to our social media campaigns.
And Councilman, so I don't have firm numbers for that because it's more of a general push in our communications, but a good portion of that is dedicated to the COVID communication. One of the things we saw during this pandemic was there was an influx of dollars to support communication specifically and its centrality to that. And we have, and frankly, we have a range of public health interventions that we need to be pushing out further. And social media is a critical tool for that. So this is a recognition of the importance of communications as a part of our department's strategy in advancing public health.
Ms. Pickard.
Thank you, Madam Chair. I just wanted to take a minute. I know we're in the middle of a 3-year push to increase the salary of our school health professionals. I've been dealing with school health and I'm sure Mr. Pruski has too, with the school board. As we move forward, I know that the goal to get to a 10% salary increase, I know that there are health professionals, mainly the portion that are county employees, not state employees, to become full-time with benefits, similar to our teaching staff. Do we have any sense of what that would look like financially for the county, but also what that would mean or how that would enhance the work or services they provide programmatically in our schools? I know it's kind of a big question, but I'm hoping to wrap my arms around this issue as that's a part of our school employment pool that is definitely being vocal currently and has been for a few years about salary and benefits. So thank you.
So Councilwoman, thanks for the question. And so this is, you're correct. This is year 2 of a 3-year adjustment in school health salaries to increase their salaries by 10%. And that is actually just one part of the strategy we have. We did that because our school health staff were being paid pretty much the lowest of any school health staff in amongst neighboring counties and comparable counties. And so we wanted to get them up to the median while the county was doing a compensation study that includes our school health staff to understand a longer term strategy to frankly improve our retention, our recruitment and retention of school health staff. We don't want to, we have a high number of vacancies in our school health staff, but more critically, we have a high level of turnover, and we want to decrease that. And so from our standpoint, that's something that we want to come out of the compensation study, is a look at what would it mean to provide benefits and to make them full-time. And we hope to get the results of that sometime later in the fall. As for the cost, that's what we need the study for. I don't know. We don't know exactly what that cost would look like.
Thank you. Madam Chair, may I just make one follow-up question to this? It's on the same topic.
I will come back to you, Ms. Pickard. Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So when I'm looking at page 240, gosh, I think it's 5. Looking at the year-to-year comparison and the increase, I do see that we have a significant portion coming from grant funding. Can I assume that that is COVID related? And can I assume when it's broken down into the object category, with contractual services receiving 7.7 million of the increase? I'm just trying to figure out, of the grant funds, how much of that is COVID related, then how much of it is dispensed contractually, and moving forward, do we anticipate that those contracts, if COVID related, will no longer be necessary, so that when the grant funding, if associated with COVID, comes to an end, that won't be an ongoing occurrence that the county would have to absorb. And I hope I didn't make that too confusing of a question.
Sure. On page 244, our increase in grant funding is approximately 9.5 million. Of that 9.5 million, 6.8 of it is related to COVID-related items. In particular, 5 million of that is for our COVID program, for the continuance of it in FY22. About 1.8 million of it is we're passing through us to the Anne Arundel County Mental Health Agency. When the 5 million was budgeted, it was just placed in contractual services. It's not divvied out for salaries and vehicle cost and office supplies and rent and like that. It was just placed in one spot as a placeholder. And then during the year, we will be charging to the appropriate areas. For example, salaries, 7 million, rent for our 2 buildings up at Bay Meadows, and we have an Odenton warehouse. That's about $1 million there. And then phone, utilities, security systems, et cetera. We have the expenditures to go into the proper line items. It just all won't be in contractual services.
Mr. Pruski?
Thank you, Madam Chair. Andrew Pruski, District 4. I had a question related to the budget and food inspectors. I see a lot of food trucks kind of popping up here and there. And, restaurants, obviously, we always go and check. But when you have food trucks, they're movable. They have to freeze, move items, whatever else. And also hotel inspectors. You know that I've been saying this for years. It's kind of whack-a-mole. We go and get them, and then all of a sudden you leave for. I know I talked with the administration about this, but the food truck piece, because there's a lot more making sure that obviously health or food safety, and then of course the hotels making sure that we have enough staff to.
Ms. Penley, did you want to take that question?
I was going to defer to Dr. Kalyana Raman.
Yeah, sorry, I couldn't find my mute button. Thank you, Councilman. In terms of staffing, I'm going to actually bring on Don Curdian, who leads our environmental health department, to talk a little bit about to talk a little bit about those inspections, particularly at the food trucks, as you know, how we do that, and our hotel inspectors as well.
Hello, hi, this is Don Curdian, Director of Environmental Health. We do license and inspect all the mobile trucks already, and we do set up those inspections, and we do contact them and know where they are going to be located so that we can, and we actually go out there while they're cooking so that we can basically do their inspection. So they get an inspection just like the food service facilities. It's just that they are mobile and they're on the move. And as you well know, we constantly, quarterly, continue to do our inspections out at the hotels. And we have one of those hotels that is a constant burden to that area and that community. The other hotels, because of your efforts to have us go out there quarterly, they have all improved. And that's a great effort for that entire 198 corridor. If we could just get that one last hotel to come into play, you've made a great change in that whole corridor out there by asking us to continue to do those quarterly inspections. And we have no plans to change that. And we have inspectors that are trained and will be doing that work.
Mr. Curdian, if the health department has a list of all the food trucks and where they're going to be when, maybe we could share that with economic development. Get that on our social media.
Hi, this is Don Curdian. Just to follow up, when I say we know where they are, it's because we have to call them and ask them where they're going to be that day. So, but I will add that they were a great resource to our county during the last year, during the pandemic, because so many restrictions were on some of the brick and mortar food service facilities, and some of them were struggling to keep employees employed or had to shut down because they had outbreaks, that the food trucks were very, very active and kept busy during the entire pandemic. If anything positive came out of the pandemic was we saw what a great resource for our county those mobile trucks are.
I certainly agree. Ms. Pickard, I think you had your hand up. No, you don't anymore. Okay. Does anyone have another question on the operating side for the health department? Okay, let's go to the capital, please.
Thank you. We'll be transitioning to the capital budget. So that's a different book, and that's the general county class capital budget book. In that book, we are the very first project 1A, 1B. I'll give you a moment to get there. So this project is our demo building code health project. This is an annual reoccurring project that the health department has. This year's request reflects an increase from the approved budget of $50,000 per year. So the request is $200,000 for the budget year and program years. This project supports not only work of our agency, but work of the code official and zoning enforcement office.
I guess we should ask questions now. I do see your hand, Mr. Volke, but I wanted to make sure, Ms. Penley, is that the only thing we have then?
There's 2 more projects.
Okay, let's go through all the projects in capital and then ask our questions.
Okay. In the same book, please move to page 6A, 6B. This is our failed sewage and private well fund. This request for FY22 in the budget years reflects a decrease from $90,000 to $80,000 based on demand of the program. Our last project, please move to page 9A, 9B. This is our septic system enhancement project. The request is consistent with the approved program of $3.3 million. This is a grant funded program. We're here to answer any questions you may have.
Thank you, Ms. Penley. Mr. Wolke, do you still have your question?
I do. Thank you, Madam Chair. Nathan Volke, District 3. Ms. Penley, I wanted to go back to the first project you mentioned, the demo building code health. So with that project, that's what you use to tear down structures that are, I don't know, a threat to health. I guess that's the way to say it. Is that correct?
I'm going to say property management code, but I'm going to defer to Don Curdian, our in-house expert on it, to provide you additional information.
Okay, thank you.
Hi, this is Don Curdian, Director of Environmental Health. Yes, so this is a joint fund. The health department uses it more for cleanups and securing houses that are open to casual entry to prevent vandalism and rodent infestations. We also eliminate trash on properties, and these are all used for vacant properties. So we've seen an increase over the years based on the foreclosures of a lot of vacant eyesores in some of the communities, and we use them for that. The larger projects where properties or buildings are unsafe, inspections and permits and zoning enforcement handle that part of the fund. Our part of it is just to come in compliance with the property maintenance code for rodent infestation, trash cleanups, and boarding up properties to make them safe from casual entry to the community.
Mr. Volke?
Thank you, Madam Chair. Nathan Volke, District 3. Mr. Curdian, thank you for that explanation. So is it the same capital project that IMP uses? I understand the health department doesn't use it, but is it IMP using that same fund of money here, this same project class for any kind of tear down project, or is there a different project class that they use, if you know?
This is Don Curdian, Director of Environmental Health. It is the same fund that they use, and they use for the larger projects.
Thank you very much.
Does anyone else have a question on the capital side? Seeing none, we know how to reach you all if we do come up with questions later on. Thank you very much for your time this morning and have a great rest of your day.
Thank you.
Thank you.
Our next presentation is from our Department of Aging and Disabilities Operating and Capital Budget Review. Ms. Gowan, Ms. Ridgway, Ms. Carasquillo, I'm sorry. This is the worst part about all these presentations, is not being able to pronounce anybody's name. I'm so sorry.
Good morning, Chairwoman Lacey and all honored members of County Council. For the record, my name is Carissa Gowan, Director of the Department of Aging and Disabilities. And with me today is Joelle Ridgway, our Deputy Director of the Department, Fiscal Manager Wendy Carasquillo, and Budget Analyst Darlene Flynn. I will begin with allowing Ms. Flynn to begin with our operating and capital budget, and then I'll follow with my presentation. Thank you.
Good morning. This is Darlene Flynn with the Budget Office. Thank you, Carissa. If you can turn to page 222 in the the proposed budget, we can go over the Department of Aging and Disabilities budget. Once you get there, we can start basically with the comparative statement of expenditures, which is on page 223. So the overall budget proposed for FY 2022 is $12.7 million. Of that, 8.4 is the general fund and about 4.4 is grant funds. The major difference from 21 to 22 is adjustment in grant funding of about $236,000. And then that's offset by an increase in the general fund of $130,000. So if you look further down the chart to the object level, this will give you a little more information in terms of how that's broken out. In the personnel services budget, there's an increase of $616,700 from FY21. And a lot of that was a new position in addition to pay package increases with benefit increases. And there are some additional grant funding in there of about $150,000. The second line under the object code contractual services, there's a decrease of $378,800. The majority of that decrease is for the ADA study, which was around $300,000. We also had some small reductions in grant funding there and also in chore services. Under supplies and materials, there's a decrease of $322,400. And basically all of that is for grant reductions. In business and travel, there's a reduction of $21,600. $19,000 of that $21,000 is grant funding reduction, and then a small general fund reduction based on historical costs. Are there any questions? Okay, then Carissa, I'll hand over to you.
You're muted, Carissa.
Sorry about that. Again, Carissa Gowan, Department of Aging and Disabilities. I'd like to take this opportunity to thank the County Executive, the Budget Office, and the County Council for your continued support of our department. As you know, the department serves older adults, individuals with disabilities, caregivers, and really anyone wishing to plan for their future. I'm very grateful for the opportunity to share the department's accomplishments and goals with you today. And thank you in advance for your consideration of my FY22 budget, as I believe that this budget will allow for us to do the continued great work we do at the Department of Aging and Disabilities. So the motto at the Department of Aging and Disabilities is making life better, and the pandemic expanded the meaning of this motto as we expanded the services we provide to people who may not have used our services in the past. Over this past year, the Department of Aging and Disabilities has reached so many people to support them, especially in light of the pandemic. The Department of Aging and Disabilities operated 23 public-facing programs and an annual budget of just over $12 million. There is a mix of federal, state, and local funds, with 70% of the department's operating dollars coming from county general funds. FY21 was very busy but impactful for the Department of Aging and Disabilities, and I'm proud of my department's accomplishments. For the sake of time, I will only highlight a few of the accomplishments that we achieved this year. We provided Anne Arundel County residents, next slide. We provided Anne Arundel County residents with over 21,000 boxes of fresh produce through our Fresh Food Friday initiative. We made over 100,000 well check calls to older adults known to our department, beginning as soon as public facing operations closed last March. Over 5,000 participants attended some of our wonderful virtual programs that we've been providing over the past year. We responded to the need to support the Department of Health and older adults through answering over 17,000 calls to the COVID Care Warm Line for assistance with vaccination pre-registration and scheduling. And finally, we distributed over 500,000 meals to people who needed them since the beginning of the pandemic. Not only did we accomplish this through mass distribution at our sites, but we also delivered meals to the homes of older adults who were unable to pick them up. Federal relief funding was critical to support the increased number of people who needed services over this past year. Through CARES Act funding from both the Administration for Community Living and Anne Arundel County, we certainly did all we could to make life better for our constituents during a very difficult time. Next slide. Included in my operational budget this year is the realignment of a staff position to in our caregiver program so that we can utilize grant funding to support more families that need it. My capital budget includes the renovation of the Arnold Senior Activity Center and the completion of the renovation at the South County Senior Activity Center. I want to commend the administration and the County Council for your investment in our older adults who live in Anne Arundel County. And I look forward to the continuation and completion of the Severn Intergenerational Center. Thank you for your resolution number 2121. Next slide. In conclusion, I'm proud of the work that my team has done over the past year, and thank you for your role in supporting the department and our community. And I can take any questions at this time.
Thank you, Ms. Gowan. Does anyone have a question? Ms. Pickard.
Thank you, Madam Chair. I don't have a question, but I can't let this presentation go by without a very hearty thank you to your team for your work. I know when my staff and I have reached out regarding individual seniors in my district, I can't tell you how grateful we are for the creative and innovative and can-do attitude to fix whatever they were dealing with. The one that comes to mind, which I really didn't know how we were going to tackle, was a senior resident who had no family, who was the victim of and displaced from a fire on at Glenmar Apartments, and y'all just swooped in and took care of it. And she needed lots of support to get to a new safe housing. And so I just want to say thank you. Your team does amazing work every single day, and I know this has been a really hard year. So please share my congratulations and thank you to your entire department.
Thank you, Councilwoman Pickard, for the kind words and compliment to my team. I appreciate it.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. I too want to share some appreciation to your team. Ms. Ridgway, you swooped in when we had a constituent, a 99-year-old veteran who was having difficulty scheduling a vaccination appointment, and you were on top of it very quickly. So I was so appreciative of that. That's just one example. Having toured the Arnold Center, I'm so excited for our residents that project is moving forward. The building has a long history here in Anne Arundel County, and it's exciting to see that it will extend for years to come. And I was excited in that last slide to see the donut shack. So thank you.
Thank you, Councilwoman Fiedler. I appreciate that.
If old folks are allowed to eat donuts, there's something to look forward to later in life, right? Does anyone else have a question on the operating or capital budget for our Department of Aging and Disabilities? I don't see any. I know we are all very grateful for the services that you and your team provide and all the volunteers also out there. And so thank you very much and enjoy the rest of your day.
Thank you.
Thanks. With that, we will be moving to the operating budget reviews for a series of departments and agencies, beginning with social services and Ms. Carnitra White.
She's on her way, Madam Chair.
Okay.
Bear with me just one moment. I'm not certain it is, she seems to be stuck in the middle here.
We've all been stuck in Zoom limbo before.
Madam Chair, I'm not certain what's going on. It looks like perhaps Ms. White is trying to rejoin. We did a test before the meeting began and she was working great. So
should we go to our next presentation
we
from
can
the circuit court?
We could do that, sure. You want to try that?
Yes, let's go ahead and do that. For the circuit court, we have Douglas Halstead. Good morning.
Okay.
Now we can hear you, but I can't see all of you. There we go. Okay, hi. Please go ahead and be sure to identify yourselves before you speak or when you begin speaking.
Good morning. My name is Judge Glenn Clavins. I'm the administrative judge for the Circuit Court for Anne Arundel County. With me today is Doug Hofstedt, our court administrator, and Nancy Faulkner, our director of court operations. I believe you're going to get a brief introduction from Beth McCoy as to our budget book pages, and then I'll come back with some remarks.
There you are, Ms. McCoy.
Good morning. Beginning on page 295, you'll see the circuit court budget book pages. And beginning on page 294, moving on to page 295 is the comparative statement of expenditures. You'll see that the circuit court has an FY22 proposed budget of $9.7 million. Under the object section, you'll see about 1.5 million in personal services. Most of this is grant changes. There's also, of course, the county pay package. And I'd like to point out a new contractual position to help the court address the backlog of cases caused by the pandemic. And this contractual position will be paid with ARPA funds. Under contractual services, there's a $177,000 increase. Again, most of this is grant changes, but I do want to point out there's also a $10,000 increase, again, using ARPA funds to help the court improve its remote hearing in its courtrooms. And unless there's any questions, I'll turn it back over to the circuit court.
Ms. Hare. Or Ms. Hare, do you mind, can we go ahead and Judge Clavins, why don't you go ahead, and that way, then we'll ask all our questions at the end.
All right, thank you. Well, it's been a challenging year here in the circuit court. I'm sure that comes as no surprise to any of you. We are the 5th largest circuit court in the state and a very busy place. And we have been open for business throughout the pandemic. That doesn't mean we were inviting people into the courthouse initially. Certainly there was a period of time when we were 100% remote. But quickly we moved towards trying to make the courthouse available for in-person court proceedings and a mix of between in-person and remote as well. We were able to do this because for almost 8 years now, we have been part of the state's automated case management and filing system, MDEC. We piloted that program for the state here in Anne Arundel County. And so all of the filing was already being done remotely by both attorneys and some pro se litigants. And so everything was being processed throughout the pandemic. As you probably know from any courtroom drama you ever saw in the movies, courtrooms are crowded places, especially when there are jury trials. You have 12 jurors sitting shoulder to shoulder in a jury box, 12 jurors who are crowded into a small jury room to deliberate for long hours. And obviously that created the largest challenge to our operations, how we could resume that essential function of our jury trials in the midst of a pandemic in a building, in a workplace that was not designed for social distancing. We quickly moved towards reconfiguring many of our courtrooms to make them suitably spacious for social distancing, erected plexiglass barriers between trial tables, between rows of jurors, spread jury seating outside the traditional jury box into other areas in the courtroom, and really created many flex spaces in order to do that. We also expanded areas where we could move large numbers of prospective jurors from which to select individual juries to spaces in the building where they could be socially distanced as well. As a result, in October and early November, when the courts briefly reopened before jury trials, before a surge sort of moved us back a step, the Circuit Court for Anne Arundel County successfully completed in a 5-week period 26 jury trials. You can compare that to every other jurisdiction in the state, which averaged 3 each for the same period of time. We were able to do that again because we had the foresight early on that we were going to have to make this effort, and we've done so successfully. And we sort of have fulfilled our ongoing reputation as among the most efficient circuit courts in the state, and we're very proud of that. We've completed a number of security upgrades at our main entrance, and there are further improvements that are planned in the next fiscal year through grant funding from the Maryland Judiciary. We're dealing with a backlog of somewhere between 1,500 and 2,000 civil and criminal jury trials caused by the pandemic. And we've already begun to eat into that by a combination of actually holding trials and a very rigorous process of triaging and pre-trialing trials with judges and lawyers to try to work cases out whenever possible through alternate means from trials. I wanted to take this opportunity to mention the growing concern both nationwide and here locally for judicial and courthouse security. We've been working closely with Sheriff Fredericks to address a major deficiency in our court, in that we don't have the ability to staff every courtroom every day with a uniformed deputy. That is the standard everywhere, and we are one of the few places I've ever been that is not routine, and we're working to try to address that, which is simply lagging behind all national standards in that regard. We've worked closely with the Budget Office to submit a conservative budget request for 2022 within the confines of the budget projections provided to us. And our overall budget submission also includes multiple grant business units for which we receive state funding for programs such as our drug court, family services, and alternate dispute resolution programs, as well as several others. So that is a quick course of what we've been doing and what we project, and I'm happy to answer any questions that you may have at this time.
Thank you, Judge Clemens. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. I guess a comment and a question. First, I have participated in several of these Zoom hearings, so I'm impressed. They go much better than I would have anticipated. So big thank you for that. And I have some questions on the jury stuff, but it's not strictly budget related, so I will follow up separately with the court on the jury things. My one question related to the budget, the positions you mentioned or the contractual services you mentioned getting funded with federal dollars. Are you anticipating then that afterwards, in next year's fiscal budget or thereafter, that you would be asking the county to pick up that slack and to take on that expense when those funds are not there anymore?
Let me defer to Mr. Hofstad.
Sure, Doug Hofstad, Court Administrator. Those are not federal funds, they're state funds. So they're coming from the Maryland Judiciary. Most of our, those grant funded positions are state judiciary grants coming for family services and for our drug court. So I think the intention originally by the judiciary was once that funding ended, we would go to the county for that, but that was close to 20 years ago. So this has become institutionalized funding through those grants. And so we do not anticipate coming back to the county saying, hey, can you pick these up? They've been most of them have been in place for 10 or more years and will continue to be funded by the state.
My apologies. I thought Ms. McCoy mentioned some federal dollars that were getting funded in here.
Yes, I did. I was referring to the new contractual position to handle the backlog of court cases that is funded with ARPA because it's pandemic related, and we assume it will take a while to handle that backlog of court cases. That's the position I was referring to.
Yeah.
Okay. So with respect to that position, same question as before.
Okay, same question. So when we made that request to the budget office, we basically said, we think we need that for a 2-year period to help us through this backlog. So that's the commitment the county is putting forward for us. And that's what we estimate the commitment will be, because we do believe we'll be out of that backlog by that time. So.
Thank you very much.
Thank you. Ms. Fiedler.
I don't have a question. Councilwoman Hare asked it perfectly. Thank you.
Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. Good afternoon, everyone. No, it's still morning. Good morning. With the $10,000 that you mentioned, Ms. McCoy, about the remote hearings, which object category does that fall in? Because I saw the capital outlay looks like it's actually decreasing by 10,000. I wasn't sure if that was what you were referring to, if it was somewhere else in the object section.
That 10,000 is under the contractual services section.
Thank you.
Ms. Pickard.
Thank you, Madam Chair. Thank you for being here from the Circuit Court. We did receive, first I just want to remind everybody, my colleagues, that the ARPA funds coming to us starting, I believe, today, potentially, and again, another installment next year, do have a shelf life into 2024. So just reminding everybody of that information that was provided to us as we talk to all of our agencies that will be using some of those dollars. My question to the Circuit Court is regarding your courtroom security needs in conjunction with the Sheriff's Office. Do the sheriff personnel that support the Circuit Court, are they assigned there regularly, or do those positions rotate? I'm asking because the sheriff has asked for 7 positions with vehicles, and I'm just curious if the sheriff deputies or whatever their rank is that are assigned to the Circuit Court, do they need those vehicles as well, or how does your courtroom function?
In regard, this is Judge Clavins again, in regard to courtroom and courthouse security, there is a corps of regularly assigned deputies, but not enough to cover each and every courtroom. Quite frankly, we have deputies assigned to every courtroom that is handling criminal matters on any particular day. But beyond that, it's sort of on an as needed basis. We have obviously other security protocols in place to to get the sheriffs to us quickly if we need them. But they're not there, and you can imagine the potential when you're dealing with parties in conflict in a courtroom and a judge who's going to disappoint one side or the other at the conclusion of a trial. The potential for difficulties do occur here constantly. So we think that we know that the staffing that's needed for in courthouse personnel, so that all of our courtrooms and magistrates hearing rooms can be covered, does need to be bolstered at some point. Aside from that, the sheriff has a whole different responsibility in their operations division for the service of warrants and other kinds of things that require vehicles. I can't speak to the specifics of their need, but they have a very significant responsibility in that regard, and that services the court as well.
Thank you.
Mr. Volkey?
Thank you, Madam Chair. Nathan Volkey, District 3. Judge Clavins, I can't imagine what that's like when people are in court getting disappointed. No, I'm kidding. But in all seriousness, it is a very real need, and I appreciate you clarifying it that way, because for those of us who are in the courtroom and do have to deal with that, it can be a volatile situation. I do just want to make sure that I understand on the ask that the circuit court is making from the county. It looks like you're really only asking for about 148,000, 149,000 in new dollars from the county that are not grant funded dollars. That's maybe a Ms. McCoy question, but I just want to make sure I'm understanding that, because you had mentioned it's a conservative budget, and from the county, it looks like that is the case.
I can answer that, or Beth can jump in. That is exactly the case. You'll see on that grant funded line, there's an increase in there, but that's because of increases that are totally funded by the grants. It's also about, we make a request that is not matching up with your budget cycle. So we've asked for more than we're going to get, but the numbers are in that system, like for family law, at the higher levels. So then we'll be working with Beth once we get our actual grant letter that says this is what you have. That number will decrease again once we get the actuals. It's just that their cycle is different than yours. So that number gets carried through for a while. So Beth, I don't know if you want to add anything to that response.
No, that sounds good. Yeah, correct.
Perfect, thank you.
Are there any more questions from my colleagues? Well, thank you to our illustrious panel from the Circuit Court. It's nice to see you all. Enjoy the rest of your day.
All right, great. Thank you.
Thank you. Madam Secretary, is now a good time to go back to social services? Let's do that, please. Good morning, Ms. White.
Good morning, council members. I apologize for my internet issues this morning, so hopefully I am not too delayed and you all can hear me. I'm having a little bit of connection issues.
No apology needed.
So I'm Parnitra White with the Department of Social Services, and first I would like to start with Beth McCoy, who will be going over our budget.
Okay, good morning. I'm Beth McCoy, Budget Office. Social Services begins in your budget book on page 254. On page 255, you'll see their comparative statement of expenditures. Social Services is proposing an $8.3 million budget this year. And the two main changes under the object section are in personnel services. There's about a $996,000 increase. This consists mainly of the county pay package, state pay increases, contractual positions, grant changes. There's also $330,000 in moving a Maryland Family Network grant from contractual funds to general funds. And there's also two new homeless outreach program manager positions in personal services. The other two changes you see under contractual services and grants, contributions, and others, that essentially is for social services emergency shelter for COVID homeless persons. And that, it's essentially $2.1 million. It consists of about $1.6 million in ARPA funding and about $500,000 in general funds You'll see that 500,000 in general fund under the grants and contributions, and that's offset by changes in grant funding. Unless there's any questions, I'll turn it over to Ms. White. Go ahead, Ms. White.
Once again, Carnitra White, Director of Social Services in Arundel County. Once again, thank you all for having us today and allowing us to present our budget. I want to thank Beth and the Budget Office for going through the budget. We, and I have a presentation that we'll go through. We've done a lot of work this year regarding the homeless services. Next slide. And I would like to highlight the work that we've done in homeless services. In 2016, we started a homeless outreach team for Anne Arundel County. We did not have a homeless outreach team prior to 16. And the efforts of the homeless outreach team was to connect individuals who were unsheltered with the resources and services that are in the county, with an effort to reduce the number of homeless persons that we have living on the street and or in camps or in their cars. We have been able to pursue permanent housing for those individuals, working with our partners. We work closely with the other partners on the CLC and the county. We've advocated for housing vouchers for persons and been able to connect persons not only to housing, but also to mental health services and other treatment services. These services have been provided by contractual staff when we started in 2016 to date. And so the two positions that have in the budget now are to make those merit staff persons so that we can reduce the turnover that we have of persons in these positions, and we continue the good work that we have been doing in order to move persons from being unsheltered and to being housed. Next slide, please. You will see just some numbers from our street outreach team. You'll see that in FY20, we were able to move 36 persons to permanent housing and 18 persons to shelter. Also, just this year so far, we've been able to get 31 persons into permanent housing and 49 to shelter. A lot of that has to do with the alternative shelter, the low barrier shelter that we have in place due to the COVID epidemic. We are carrying 133 open cases in our homeless services prior to the pandemic, and now we're up to 204 cases with a monthly average of 119. Some of that is the way that we're tracking the data and the changes in tracking of the data. We used to just make referrals, and our outreach team would make a referral to a shelter, and then it wouldn't count that as a case. But with the alternative shelter, we are continuing to provide case management for those persons that are able to get into shelter in order to connect them to the resources that are needed. Next slide. And then as Ms. McCoy mentioned, we have the alternative shelter. We've been running the alternative shelter since June of last year in partnership with Arundel House of Hope. We're doing the daily operations of the alternative shelter. We work closely with crisis response and other providers in the county. And you'll see that we've been able to serve 486, nearly 500 persons in our alternative shelter. These are persons who did not have a place to shelter in place. Our alternative shelter is a low barrier shelter, so persons are able to enter this shelter as long as they are not on a sex offenders list and they don't have any outstanding warrants. This has been a great help in getting persons who we never thought would come off the street into shelter, particularly couples who often don't want to separate. They're able to come into the shelter, and then we're able to move them along to permanent housing or other temporary housing. And you can see those numbers there. And I think we've done an excellent job in moving people from unsheltered into housing. And then lastly, we've also ran a quarantine and isolation shelter. So for persons who are unsheltered or were unable to safely isolate or quarantine at home, we've served 271 persons during the pandemic in our quarantine and isolation shelter. That concludes my presentation, and I'll answer any questions that you all may have.
Thank you very much, Ms. White. Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. Thank you for that presentation, Ms. White. About a year ago, right before the pandemic, you and I had chatted a little bit about adoptions together. So in the contractual services, I was wondering if we were able to pursue that, if they're included in that line item, or if that is not something that's in this budget.
That is not something that is directly in our budget. Money for that would necessarily come from the state, and I know that the state has some programs with adoptions together. So most of our foster care budget comes directly from the state.
Okay, perfect. Thank you.
Ms. Pickard.
Thank you, Madam Chair. Allison Pickard, District 2. Ms. White, I just want to, like I've done with the Department of Aging, I want to thank you and your team for the hard work, especially with the homelessness prevention and all the work that's gone into that. I know your team has met in Glen Burnie with my constituents earlier prior to the pandemic, as we really work collaboratively to deal with the very challenging issues of chronic homelessness in the county. So I just want to commend all the work that your team has done. And I did want to, I know as we start to see things opening back up, I wanted to know if y'all would be continuing some of the locating of social workers in our libraries and alternative locations. If you could speak to that just briefly, that would be great. Thank you.
Sure. We've actually already begun to have our social workers back in the library, both in Brooklyn Park and in South County. So they're there 2 days a week. They're starting this month, going back 2 days a week. And so we do plan to continue those services.
Thank you. That's fantastic. Thank you so much.
And even during the pandemic, we did pop-ups in the communities. We've done virtual meetings, virtual cafes. So we've continued that work throughout the pandemic. And actually the virtual cafes have been very successful because more people can join them without having the transportation issue.
This is Sarah Lacey, District 1. I want to jump in both to echo Ms. Pickard's compliments to your department, but also to amplify them. Linda Harris, who's my legislative assistant, has told me to use the word relentless to describe your pursuit of resolution to various problems that our constituents have had with obtaining services like EBT and the different kind of things that are a real headache for people, but they need to eat and they need the help, and it's just really difficult to obtain. So we really appreciate your persistence, and I know that you've done the same throughout the county. So thank you very much for all that you do. Does anyone else have a question for Ms. White regarding social services operating budget? Seeing none, we'll be moving on. Ms. White, thank you again for your time today and dealing with the difficulties of Zoom. As we expect, you would not give up just because of Zoom. So thank you.
Thank you all. Thank you for the time.
Enjoy the rest of your day.
Thank you.
Our next presenters are from the State's Attorney's Office. We have State's Attorney Ann Colt-Lettis and Jessica Daigle.
It's almost afternoon, but I can still say good morning. Hope everyone's doing well. I had the opportunity to listen to the last couple of hours. It was very interesting. I learned a lot about budgeting and what's going on in the county. Ms. McCoy is going to give the opening remarks about our budget book.
Good morning, Beth McCoy, Budget Office. The State's Attorney's budget book pages begin on page 300. And if you'll turn to page 302, you'll see the comparative statement of expenditures. The State's Attorney's proposed budget is $14.9 million for FY22. Under the objects section, you'll see a $1.4 million increase in personal services. And this consists of the countywide pay package, as well as full year funding for the 10 body worn camera positions, as well as changes in grant funding. There is under contractual services, there's a decrease in primarily grant funding. However, this is offset by cell phone hotspots for attorneys in the courtroom, as well as under supplies and materials, materials for the body worn camera program positions. And unless there's any questions, I will turn it over to the state's attorney's office. Please go ahead, Ms. Lightis.
Okay, great. I think we have a PowerPoint presentation. And if you can just move to the next slide, please. Just a reminder of how many folks we actually have here. It's about 137, 58 assistant state's attorneys. That includes jobs that are fully funded by grants or partially funded by grants. We have job share, several people who share a job, and then 2 body-worn camera staff members. We have 18 victim witness advocates, including some who are doing a job share, and then we have 67 support staff members, including some part-time workers, and then the new paralegals that we will be hiring in July due to the increase in the budget. Next slide, please. So this is the breakdown of how our office works. We have 2 deputies under me, Deputy Jessica Daigle, who I'd like to thank for all of her hard work. She's here with us today on the budget. If you have any specific questions, she may be able to help, although she has brought me up to speed in a lot of the more intricate details. And she helps run the district court team as well as part of the circuit court team. And then Deputy Brian Marsh, who runs the support staff and other felony teams here in the circuit court. So we are divided up in that way. You can see that we have multiple trial teams that specialize in different kinds of prosecutions of crime, including violent crimes, special victims unit, which deals with child abuse, child homicide, and sexual assault. We have narcotics teams, auto manslaughter, and then we have a misdemeanor general felony prayer for juries, juvenile, a financial crimes team, and we have drug court, and then 18 members in our district court. We have 2 district court locations. Next slide, please. So one of the major accomplishments that we did and why we have an increase in our spending this year, not because we went over budget, but because we got lots of grant funding this year. And our grant funding allowed us to hire a child survivors justice program leader, Ms. Kendall Patterson. She is a clinical professional counselor who is adept in treating young people who have faced trauma in their lives. And what we're finding more and more is that we have young people who are victims of sexual violence, child abuse, and they are coming to court, and we are expecting them to act a certain way in the courtroom or testify a certain way. And it's their adverse childhood experiences, that the trauma that has happened to them as children, that we need to know about, and we need to know how to present their testimony in court. We even need to know how to talk to them. And we need to be able to explain to a jury why they may answer questions a certain way or act a certain way, or perhaps even why they reported a crime sometime after the fact. So we are very happy to have her, and our grant funding pays for her to work with our juvenile team and our special victims unit team, as well as really any child victim of any crime. She works in our office 20 hours a week, and she's already teaching police officers, prosecutors, and our victim advocates. So she's a great addition to our team. Next slide, please. So we also have another Spanish-speaking victim witness advocate, and we hired her last, I think a few months back, I think right at the beginning of the pandemic. And what's so excellent about Ms. Jean Louise is that she speaks several languages, including Spanish, and she's located here in the circuit court. Previously, we only had one other victim advocate who was fluent in Spanish in the district court. And so Ms. Jean Louise is able to help witnesses and victims who speak Spanish. In the actual courtroom, the court will pay for Spanish interpreters, but that's only during court hearings. So when we want to speak to witnesses on the telephone or have meetings in person, we need to have an interpreter, and that is has to be paid by the state's attorney's office. So you can imagine we used to spend a lot more money on the language line when we had to interview witnesses and victims on the telephone. But now that we have Miss Jean Louise, our spending has gone down with that. We've also been able to switch an attorney or move an attorney into our automobile manslaughter unit, which is extremely successful here in the county. We have a lot of highways in Anne Arundel County, and that also ends up with a lot of impaired driving cases and manslaughter cases where people are under the influence of alcohol or drugs. And those are extremely complicated cases. It's like trying a homicide, a murder trial, because of the technology that you have to use, expert witnesses, and extremely complicated evidence. So we are very happy to have that second attorney working on that unit. And we also try those cases. Some of the cases where people are killed in automobile accidents don't necessarily include drunk and drug drivers, but they could include someone who's speeding or runs a red light. And those cases are tried in the district court, but they still are very technical and complicated. So we send those attorneys to the district court to try those cases as well. I talked about the grant funding that we were benefiting from. We also were able to use that grant funding to hire a second IT professional in our office. We, again, have 137 people, and there were times during the pandemic that the majority of them were working remotely. Now, we still have been conducting court. Sometimes it was over the telephone. Sometimes it was in person. In the district court, we never stopped going to court in person. But in the circuit court, we stopped many of our in-person court appearances during the height of the pandemic. So the second IT person has been extremely valuable, keeping us all online and everything working smoothly. So I'm grateful for that funding. Next slide, please. So the key objectives for our office is to continue to try and get grant funding. As you see that we got $194,000 extra in grant funding last year. One of our employees is very good at grant fund writing, and she has helped us do that for the last 2.5 years. We also are partnering with police and other agencies for concerted efforts in rehabilitation, prisoner reentry, and that sort of thing, diversion. Right now, we have agreements with Anne Arundel County Police Department and Annapolis Police Department for diversion programs, pre-arrest or post-arrest diversion programs for juveniles as well as adults to try and get those folks who are committing low-level offenses the services that they need prior to having them formally brought into court. So one of the parts I like about that is that any crimes involving a victim, the victim has to agree that that is the way to proceed. We're not doing anything without victim input or agreement. The next thing that we're focusing on is continuing to fight the scourges of crimes that are related to drug abuse and drug use by diverting those folks into treatment and rehabilitation. We continue to fund our drug court and try to increase our numbers so that people can successfully complete drug court instead of having to go to our detention center or to jail. It's a lot more cost effective if people are out in the community and working and going to treatment versus just being locked up. So we see that as very important, and we are partners with the district court and the circuit court drug court programs. And last, one of our newest endeavors is that we are working on instituting a mental health court, which is modeled on our drug court. And this is to address the many cases that come before our courts where people have issues of whether they're even competent to go to court. And we try to deal with them in the community so that they don't come back and commit more crimes because of their mental health issues. And this is predominantly matters that we see where it's low-level crimes in the district court, that we see people coming in repeatedly, not because they have a criminal intent, but because their mental health issues are causing them to do certain things in the community, and then the police are called. So those are going to be wraparound services. We've had meetings with our district court judges, and we're moving forward on that program. Next slide, please. So one of the reasons our budget has increased is the really the plan and the mandate for body-worn cameras here in our county. And so what this is going to look like is we already have hired one under the funding from last year. That person, body-worn camera personnel, was funded this past January. We had a half a year's funding. So we now have 3 body-worn camera professionals, paralegals, working on the body-worn camera unit. We have an attorney who's dedicated to this, and the new funding in FY 2022 will fund 9 additional people, 7 paralegals and 2 attorneys. And we will be housed together with the Anne Arundel County Police body-worn camera unit in a new location off of Bestgate Road. And it is space that we are being given from the administrative county or the state administrative office of the courts. So that has all been worked on. I think we are moving in June. And so we'll be working closely together with the Anne Arundel County Police, getting that body-worn camera unit up and running. We're very proud of that. And that is, again, the significant amount of change in our budget due to that funding for that personnel group. Next slide, please. So we were told that if there was anything that was out of the ordinary in our budget, that we should put it in a separate slot, and which is what we've done. So our first priority, what is being recommended to be funded, is the State of Maryland versus Jared Ramos expert witness. This is not additional funding that we're asking for. This is the same exact funding we asked for last year. It just did not get spent last year because of the pandemic. The case was postponed in December, immediately before I was about to go to trial. You heard about that 5 or 6 weeks that the court was open in the fall. This case was going to be just a week or 2 after the courts closed last November, when the numbers in the pandemic got rather high. So this is for our expert doctor, Dr. Gregory Sadoff. He is through the University of Virginia, and Dr. Sadoff does not get paid directly for his testimony. The University of Virginia, where he's employed, is going to be the entity that receives the funding. And I've told you guys this last time when I had the presentation. What's important to note about this funding is that this expert witness has been, he is on retainer with the FBI for every single Wednesday. And the FBI has permitted us to use this doctor and his resources for the past 1.5 years at no cost to the county or to the state's attorney's office. But now that the case is going to trial and the witness will be coming and testifying and traveling and continuing to consult, he's no longer going to be, we still have to start paying the University of Virginia now. It's no longer him being on loan to us from the FBI. But I would say that 90% of the costs or the hours that we've worked with him so far have all been funded by the FBI. Next slide, please. So if you have any questions specifically about the grant funding, Ms. Daigle, my deputy, will be able to talk to you more detail about that. But what we have seen is that we have a reduction in VOCA funding, which is the largest grant that our office receives. Our current award was originally a 2-year award that was supposed to end in September 2020. However, due to the COVID-19 pandemic, the Governor's Office of Crime Control and Prevention extended the award instead and released a competitive notice of funding availability. So our office has continued to receive the same amount of the VOCA funding for the last 3 years. However, it is believed that these reserves are now depleted. The federal VOCA grant gives money to Maryland, and they decreased their federal grant by 33% in FY20 and by 26% in FY21. So the Governor's Office of Crime Control and Prevention has advised all the agencies, including us, to expect a minimum decrease of 25% in fiscal year 2022. And due to the decrease in funding that the state of Maryland expects, it's also going to have to do that with us. So that is why we are asking for some stopgaps for that. Maryland law mandates that all victims of crimes have the right to be notified about their cases, to attend court hearings and speak at criminal proceedings. And there are multiple forms and advisement that victims must receive before, during, and after a criminal case is brought. And so our victim witness advocates that are funded through this grant provide those mandated services directly to victims of crime. So the VOCA grant, as it now stands, covers about 53% of the salary and fringe benefit for 4 State's Attorney's Office employees. 2 of them are full-time employees and 2 are employees who job share. And all 4 of these employees provide the services that the State's Attorney's Office is mandated by law to provide to victims. And we would have to do this even if we did not have this grant. So our request increases the county's contribution to salary and fringe for these employees to cover the expected grant shortfall. So the amount that we're asking for to cover that shortfall is $23,323. Next slide, please. So I believe our last priority, our third priority is going to be some one-time and then some recurring costs for the body-worn camera unit that will be housed with the police. We are asking for $3,705 for a copy machine and a one-time cost of $1,000 to cover headsets for the 10 to 11 people who will be over in that unit. Again, you can imagine it's very noisy if you're all in a giant room separated by cubicles, and you have to listen to body-worn camera footage and everybody's listening to that at the same time. These are for headsets so that the paralegals and the attorneys can listen to this at their desk and not be overheard by others. This is a one-time cost for the headset for the paralegals. And the last priority that we're asking for, next slide please, is a hotspot cell phone Wi-Fi hotspot, and that is $1,350. We have this funding covered through the end of the year. It's actually January 2021 through December 2021. So this cost that we're asking for will really just cover January 2022 to the end of the fiscal year. And the reason that we need this, even there is Wi-Fi in the district court, it does not have the ability to handle the data download that we need. And we provide live time information to the courts. We can also have all of our files electronically stored on there. In fact, we can do a mostly paperless docket. We have police reports, we have photographs, we can send these and show them to the court and to counsel right there in the courtroom. And so these, we actually get cell phones that permit us to have this Wi-Fi hotspot. So the grant funding runs out at the end of the year, and so we are asking for the county to cover the cost of this for the attorneys that are in the courtrooms in the district court. And with that, I think I would just like to point out that we didn't ask for, and that's the end of the slideshow, we did not ask for any additional positions this year. We have been very satisfied with what the county council has given us for the last two years now. We have a strong staff, and you know, we're doing a great job during the pandemic. One of the things that the grant funding allowed us to do, which is kind of funny, is to buy these clear masks that we're all going to be wearing in court very soon. Because we found, Ms. Pickard looked away, I have to just show it to her. We're going to be wearing these clear masks. I know it's not great. We're going to be wearing these clear masks when during distinct parts of the jury trial, opening statement, closing statement, and then when we are asking witnesses questions. And then the rest of the time we have to wear our cloth covering, our medical mask, that sort of thing. And we're hoping that we'll be able to do this with our witnesses too. In the pending case that we have, State of Maryland versus Jared Ramos, the court has said that we can do this And we can also have our witnesses, when they're on the witness stand, after they go to the stand, take off their mask and put their clear mask on so that the jury can see their face and hear them. And obviously, the reason that's so important is because you have to judge credibility. You have to look at the witnesses' expressions. You have to see their face. And unfortunately, during the pandemic, we've had some trials with child abuse cases where the jury was not happy that they couldn't see, the witness's face, the children's face. So we're hoping that will help a lot in the courtroom. So I think we have a very conservative budget. We've kept our spending low. We won't go over budget for another year. And I'm very proud of that. And I'm very thankful to Ms. McCoy and to Ms. Daigle for all the help in preparing this year's budget. And I'll take any questions.
Thank you, Ms. Lippis. Colleagues, who has a question? What? No one has a question?
Come on, no question.
Really? You aced it, Ms. Lippis. Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. I just really want to say your presentations are so detailed and thorough that I don't have any questions. So thank you.
Thank you. And we, I do want to put in a plug for electronic courts. There's my telephone ringing. The electronic courts, one of the things that the pandemic has forced us to do is just get more tech savvy. So, it's forcing us to be super creative and do things. And, it's pushing us all into the next level of technology. So it's pretty exciting. It's helping me not be a dinosaur. So, thank you so much.
Okay, well, thank you. Thank you very much, Ms. Lippis, Ms. Daigle. Have a great rest of your day.
Thank you. Bye-bye.
All right, take care. Our next presenter is Judge Maureen Carr York with the Orphans Court. Hello, I see you have someone else with you. Oh, and you're muted, so we can't hear you.
I had not muted myself. I'm sorry. Thank you. Chief Judge Nancy Phelps is with me. We're trying to sit far enough apart to be appropriate in these COVID times, but have an opportunity for you to see us and to hear from us. We are a court of the state of Maryland, established by our Constitution. Actually, our court's been in existence since the 1600s. I think they brought the idea over on the Ark and the Dove. But we are a court of limited jurisdiction. So unless you're interested in handling an estate or have to deal with the death of a loved one, you might never come into our courtrooms or see us at all. I do want to thank the circuit court folks who were on earlier, because they have worked with us and made it possible for us to continue serving the citizens of Anne Arundel County all the way through the pandemic. We did not miss, but I think 1 week in early March, when everyone was trying to get things settled about how many people we were allowed to have in our offices doing the jobs that needed to be done. So Judge Phelps and I have been present in our courtroom although all through the pandemic. We are fortunate enough to have excellent staff who serve us, who are part of the Register of Wills office. For those who don't know, the Register of Wills is actually a state agency, and therefore they answer at a different level to a different person, in this case, the comptroller. And we are county employees, and therefore we are under not their jurisdiction or any direction from them. We respond direct to the Chief Judge of the Court of Appeals. And she did restrict what we could handle in our courtrooms for a number of months, in that we had a restriction on members of the public or attorneys coming into our court. During that time that we were working without being able to bring them in, we were handling paperwork. and to give you an example of why we were essential employees and why it was necessary for us to come in, I'm remembering a mother who lost her son, who was in his 20s during the pandemic. He owned a car. He didn't have many belongings, but he owned a car, and the finance company was asking for payments. She didn't just want to turn it over to them because she knew there was equity in the car, but the only way that she could deal with the finance company, had the power to do that, was if we had signed the documents that enabled her to obtain the order that permits her to act in the stead of her son. If we hadn't been in doing the job, that lady would have been in a terrible situation for many, many months. So that's why we serve carefully and for throughout the time. And again, grateful to the circuit court for providing the ability to come in the courthouse and to get our job done. We have been back to having hearings for quite a while now, and we are working on a backlog. As you heard from the circuit court, they have a backlog, we do as well. The backlog in our case is due to matters that have to be handled with live hearings. And so we are working our way through that and trying to increase the number of hearings a day. We are ladies of very little trouble to you. We don't ask for a lot. You have the budget. Ms. McCoy has prepared it. She can answer any questions, or I can, on the budget itself. But we do have two major expenditures coming up that I want to tell you about. They are not in the budget because they have recently arisen. Yesterday with regard to our recording system. As some of you who have dealt with the Orphans Court know, we do not have the kind of recording system or paperwork system that the Circuit Court has. Our system is self-contained, and we record with voice recording equipment, and we provide copies in the form of a disc to litigants and other interested persons who want to have a record of the hearing itself. Our equipment has been in use for 10 years. It operates on, I couldn't even believe this, on Windows 7, for which there is no maintenance available. We have no way to upgrade it or to fix it, but we've been limping along with it and have dealt with it until now. And yesterday at the conclusion of a hearing, fortunately at the conclusion of a hearing, it died. It just absolutely died. Our IT department came in, did everything they could. They have us sort of pieced together to hopefully last for a month or so, but there's nothing except to obtain new equipment. The equipment we have, when purchased, was about $9,000. And since that was 10 years ago, we're expecting that it's going to be a lot more. And we are expecting that Ms. McCoy will submit a fourth quarter transfer for us so that we can obtain that equipment sooner rather than later, or we will have to cancel hearings. So you will be receiving information on that. I don't yet have an exact quote for the equipment. Tried very hard to get it since yesterday, but we do not have the quote yet. One of the things we're hoping to obtain with that equipment would be the possibility of conducting hearings while we're based in the courtroom so that witnesses who are out of the area can participate. We recently had an 80-year-old lady in California who very much wanted to participate. She had a legitimate interest in the estate, but she had been advised not to get on an airplane and try to come to Maryland for that hearing. Fortunately, in her case, she was able to hire an attorney, and her attorney presented her case very ably. But in many cases, a person who doesn't have access to counsel would really have difficulty being heard. So that would be the only upgrade we're looking for to the equipment, is the ability to do that. The other thing that we expect to be dealing with in this next year is our move to a different building. It is not by our choice. We would much prefer to stay in the courthouse, but the circuit court has outgrown its chambers. At this point, they have added judges over the years. They have visiting judges come in on basically every week. They have a number of visiting judges come in to conduct hearings, and they need the space that we and the Register of Wills currently occupy. So we are told we'll be moving to an office building on Bestgate Road, and that when we are moved in there, we will not have security. We've asked the sheriff for security. He has not indicated, well, he has directly indicated he won't provide it, at least not in his budget. And we feel it's just as important, since we make people angry too, occasionally, that we have a magnetometer and a officer at the door to make sure that we are not exposed to unnecessary dangers in our chambers or in our courtroom. At this point, the Register of Wills has been working very hard, trying to get this approved for funding for the coming year. We don't know when we're moving. Last time we heard it sounded like by the end of this year, but you will probably hear at some point about a need for security equipment and security personnel during the hours that the court sits in session. So those are the two big changes coming up. We are very happy to take any questions that you might have. And
tell them the location of where we're moving.
Oh, we're moving to Bestgate Road.
Judicial training.
What used to be the Judicial Education Department, which is, and the Administrative Office of Courts, which is now over off of Riva Road, off of Harry S. Truman Parkway, I believe. And it's a kind of remote situation over there. The sheriff's office, or part of the sheriff's office, is moving into the back portion of the building. And so they'll have officers there, but unfortunately that wouldn't do us much good security-wise if the weapon and person intending to use it are already in the building. So thank you very much, and we're ready for any questions.
Well, thank you, Judge York. We did hear that the judiciary is leaving you nice furniture. So I didn't hear you mention furniture. You must be satisfied with what they're leaving. I don't know.
We haven't seen it.
Okay.
We have no idea what we're getting over there. But
you reserve your request in case the furniture is not adequate. I hear you. Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. Good afternoon, Your Honors. Hope you're doing well. Your budget actually decreases by $5,000 pretty much across the board. So with this ask about the Windows 7 machine, where is that coming in?
I'll ask Ms. McCoy to answer that.
Okay, the funding that they're requesting for the recording system isn't in the budget because my understanding is that the recording system died yesterday. So that's why it's not included in here. The $5,000 decrease you see in the budget book page is the removal of the one-time bonus payment from last year, as well as realigning their travel expenses with prior years.
And we haven't used travel expenses.
We hardly spend any money.
Well, wait a minute, let me ask this. What are the travel expenses? Is that what we had asked for if we want to attend a conference?
Yeah.
This is reimbursement for mileage, and what we always do compare with prior years and see what those expenditures are to align them.
Okay, thank you. We do want someday to be able to register for conferences. Orphans courts, probate courts across the country meet and exchange information, ideas. And I'm not looking for a free trip to Disney World. We were just interested in being able to pay registration fees and attend some of those functions. We'd be happy to do it remotely. We're just, we're hopeful that we'll have an opportunity to do that one day as well.
Mr. Volkey?
Thank you, Madam Chair. Um, so I guess I know I've heard before from you and other judges on the Orphans Court about the archaic technology that you're working with. We've got other people in the same building coming in, getting hotspots for the courtroom, and you're running on Windows 7. So I guess what I want to understand is the $1,500 that you're asking for under your supplies and materials, is that sufficient for you to upgrade your system to, one, get out of Windows 7 and get machines that are in the 21st century, and two, to get, I was being flippant about that. I know Windows 7 was in the 21st century. And number two, about the recording system, to be able to replace that. Do you have any idea what those things would cost for you to do that?
We tried to get a figure for you for today, but although our IT guy called in a number of places, they're all pretty busy. Nobody was able to even give an estimate. All we know is it cost $9,000 10 years ago. So if you can extrapolate from that, and wanting to upgrade to hear witnesses remotely, I'm thinking it might get up there a bit, but I'm not in that field and I honestly can't give you a better estimate than that. But again, it wouldn't necessarily be part of this budget. We're hoping to get it as a fourth quarter transfer so we can actually install it before FY22.
Ms. McCoy?
Yes, I just want to reiterate, we will be proposing as part of a fourth quarter transfer bill funding for the recording system.
Thank you.
Thank you. Ms. Fiedler?
Thank you, Madam Chair. Amanda Feather, District 5. And this question is for Ms. McCoy. Can you share, and if you can, I understand, if that fourth quarter transfer includes the upgrade, or is it just recording for recording?
Right now, I don't think we have all the details because we just found out about this yesterday.
That's when it burnt up, was yesterday at the end of the hearing. And I have been having a lot of trouble with that for the last 3 months. I've been saying it's been sticking. I don't even know if it's recording. We shut off. We look like the Mickey Mouse Club down there because we shut it down and then we have to start over again. It's embarrassing, very.
Judge Phelps, thank you for your comment there. I have to identify you for the record. Mr. Volkey, do you still have another question?
I do. Thank you, Madam Chair. Nathan Volkey, District 3. Your Honor, so I want to switch topics over to the new location that you're going to have in the old Judiciary Training Center. So I have heard a lot from the Register of Wills office, and we talked a good bit with Central Services last week about that new space and the build out over there. I understand there was a meeting yesterday, I believe, between the Register of Wills and the Central Services Department to talk about the security issues, particularly the way one of the courtrooms, I think in the back of that space, was oriented for you all. I just wanted to check with you. Have you heard the outcome? Are you all satisfied with that? Are you satisfied with the design plan over there and what Central Services is offering in terms of what you will have, both for functionality for your job and then for security for you all?
We know that the Register of Wills has put a lot of effort into trying to obtain a good setting for us to do our job, both the courtroom and the chambers area. And we know that she's been working especially hard on the security issues on our behalf. It appears that the fire marshal came in and didn't like one of the designs and wanted a different kind of locks on the door, which results in us being far less secure and far less able to get away from someone who might have evil intent. I think the Register of Wills is hopefully going to be successful in at least preserving a way for us to get away from problems. We don't presently even have plexiglass. I mean, a lot of the courtrooms, most of them now have plexiglass for the judge, for counsel. We don't have any of that. I don't know for sure, but I'm wondering if they just didn't bother to install any of that for us because they know they're going to change the space as soon as we're out. I wish I had more information for you, Mr. Volkey, but we honestly haven't been personally included in any of the discussions.
Does anyone else from my colleagues have a question?
Madam Chair, if I may.
Ms. Pickard.
Thank you, Allison Pickard, D2. I'm just curious, are there 3 orphans court?
Yes, yes. There are 3, but since the first week in March of 2020, Judge Phelps and I have been the only 2 coming into work.
Oh, going into the office. Okay, thank you. And you're, okay, thank you.
And we are unable to work remotely. We, our paperwork system is literally still paper. It's that way in most orphans courts across the state. So we can't even do paperwork at home. They're original documents, the originals filed with the court, we have to have in front of us to sign. And the way this orphans court operates in most of the jurisdictions is that at least 2 of the 3 orphans court judges have to be present at any given time to sign documents and to conduct hearings. And that's why Judge Phelps and I have been the ones doing that because we have to be there in order to serve the citizens. We're not able to do it from home. We're just hoping to get permission to have, and to get the equipment to have remote witnesses. The possibility of having remote judges just doesn't exist. There are certain court rules and court cases and laws that have been established that require our kind of orphans court to sit together in person.
Thank you. You appear to be remote currently, though.
We're sitting in my, no. Well, let me explain this. We are on Zoom with you. We could not do this with litigants in a case. And Zoom would not be considered, Ms. Pickard, Zoom would not be considered an appropriate way to conduct court business and to keep a record. It just isn't allowed. We've discussed this through this year with the administrative judge of our circuit court, with the administrator of the court, with representatives of the administrative office of the courts, and with the Attorney General's office. This is the best we can do.
Mr. Volkey.
Go in if we're sick.
Thank you, Madam Chair. Nathan Volkey, District 3. So Judge Carr-York, I just want to make sure that I understand the colloquy that you were just having with Councilwoman Pickard about the judges. So are you telling us that we're funding 3 judges and we have funded 3 judges for the past 14 months, but that there only have been 2 judges who have participated in any cases that have come before the orphans court for that entire period?
I feel uncomfortable addressing the issue, but factually that is correct.
Okay, thank you.
Ms. Rodvian.
Thank you, Madam Chair. Lisa Rodvian, District 6. So I'm curious for that judge, what accommodations were provided under the various laws that are applicable?
There is no way to allow someone sitting as a judge in the orphans court in the all but one jurisdiction in the state of Maryland to conduct their part of the process remotely. It is not possible to do. Ms. Rodvian, we discussed this at length, including with the Attorney General's office. Can't do it, is what we are told. We were very safe. Now, Judge Phelps and I are not spring chickens. Well, I'm not. I'm 67 years old and have multiple pre-existing conditions, as do most people my age. And my doctor was, very, very keen on making sure I did not needlessly expose myself to the virus. But our courthouse was a very safe place to be and remains a safe place to be. Of course, now we are fully immunized, but back throughout this time, we drove into an underground parking garage. We took a judge's only elevator to the 4th floor. We walked through empty hallways. We walked into the Register of Wills office and through that to the orphans court chambers, and we did our jobs. And it was a very safe place to be. certainly safer than, going to the grocery store or other places.
So just to clarify, the orphans court judges do not have any sort of health benefits. It sounds like you did not have a health professional sign off on any medical, and you did not offer any medical accommodations.
We are not capable of offering anything like that. It is not something that we can do. And the county's office, Ms. Stanton's office has no jurisdiction over Register of Wills or orphans courts. So it simply is not something we can do. We can't work with a judge who isn't present at the courthouse or in our chambers or our courtroom. We tried.
I have to say that's a little hard to believe. We're a council that's functioned also as a legal body governing that, that we have functioned for 14 months completely remotely. So and I'm a public school teacher. I taught for most of the past 14 months remotely. So it's a little hard to believe that it's not possible, that you couldn't send documents through the mail. You couldn't have meetings over Zoom like we're having right now.
You can't. We have been told it repeatedly. You can't do it. I'm not in any position of authority to make changes. Not even Judge Phelps, Chief Judge Phelps is in a position to make changes to the statewide rules. We tried.
So I'm
a little frankly offended by your saying you don't
This is
believe
the chair. Let me halt you all, in part because we're talking over each other and in part because we're not identifying ourselves when we're going to speak. And we're going to stick to asking one question and round robin around to everybody. So I'm going to go to Ms. Fiedler, and I'm happy to come back to you, Ms. Rodvian.
That's fine. Thank you.
Thank you, Madam Chair. Amanda Fiedler, District 5. What I'm hearing in the line of questioning is that even if you wanted to have accommodations for all three judges, including yourself, it is beyond your purview. And I just don't think that it is fair to compare apples to oranges. Judiciary is much different than the legislative branch, is different than the executive branch. So I just want to, as I've thanked other departments before us, want to thank you two judges for pressing forward through this pandemic, for showing up to do the hard work that you were elected to do. It has not gone unnoticed. So it is appreciated, and thank you.
Thank you for saying that.
Thank you.
Ms. Rodvian, you've disappeared, but does anyone else have a question? Okay, Ms. Rodvian, go ahead. Oh, no, not go ahead.
No, I was just saying I am here.
Okay.
I am here. I didn't want anyone to watch me eat.
Gotcha. Okay, so if no one else has a question, thank you very much, Chief Judge Phelps and Judge York. We appreciate your time this afternoon and all the work that you do. Enjoy the rest of your day.
Thank you, ma'am.
Thank you.
And our next presentation is from the Board of Elections. We have Mr. Joe Torrey. Good afternoon. I'd like to remind everyone to please remember to state your name before you make your remarks, so our record is clear. Mr. Torrey, are you going to start the presentation?
Yes, Beth will go over our expenditures, and then I'll have a brief statement.
Excellent. Thank you.
Thank you.
Okay, so beginning on page 315 is the Board of Elections in your budget book. And on page 316 is the comparative statement of expenditures. Under the object, you'll see that of the $5.8 million proposed FY22 budget, Under object, there in personal services, there's about a $17,000 decrease. And this reflects increasing turnover to adjust with prior year's experience, and offset by an increase in the state salary pay package. Under contractual services, the $455,000, that is primarily State Board of Election charges that each jurisdiction is charged. And under supplies and materials, the $16,000 decrease just reflects that less supplies are needed for the gubernatorial primary this spring, as opposed to what was needed for the general election this past fall. And unless there's any questions, I'll turn it over to Mr. Torrey. You're muted, sir.
Thank you, Beth. As you know, it's as with the other agencies, been very challenging this year. We threw the kitchen sink at the election and it actually worked. We had to change everything over in 3 months' time. Our major accomplishments over the past year, we successfully conducted the 2020 presidential general election, including managing historic voter turnout. 77% of eligible voters cast their ballot during the general election, including over 112,000 during early voting and over 149,000 by mail. We had a problem recruiting election judges in the past election due to the pandemic. So we established 31 voting centers located throughout the county. The centers provide election judge and voters with personal protective equipment to offer safe, convenient opportunity to vote in person. We implemented and managed 32 ballot drop boxes throughout the county and publicly canvassed more than 125,000 mail-in ballots prior to election day. We established public streaming of the canvassing process and online video teleconference canvass meetings for the Board of Canvassers. Over 106,000 voters returned their ballots via the drop box. The county currently has over 428,000 active, inactive, and pending registered voters. We are number 4 as far as registered voters in the county. We're the number 4 jurisdiction. We're now more registered voters than Baltimore City. Our key objectives moving forward in this budget, we're going to manage mail-in and in-person voting during 9 election days in FY22. So we're moving back right now to a regular election. So we'll have 8 days of early voting and of course the gubernatorial primary election day. So that means we'll have 195 polling places and 9 early voting sites. Moving forward, our objectives, we have to complete a census-based redistricting prior to the 22 gubernatorial primary election. There is a problem, as you know, with the census data and when we're going to get that data so we can go with our maps and make our new maps. We are GIS, so we've worked with the 10 years ago, we worked with the county OIT department, and we are all GIS census. During the 2021 legislative session, moving forward, there's some new things we have to implement. House Bill 1047 codified ballot drop boxes and how we manage those. All of these things that I'm going to talk about now, the state board has to promulgate regulations in concert with the local boards and the state board. House Bill 1048 and Senate Bill 683 establishes a permanent absentee ballot list. So people won't have to fill out an application every year. It'll establish an absentee list. House Bill 745, that increases our early voting sites, and Arundel County will have to add 2 new early voting sites. We have 7 now, to increase to 9. And House Bill 222, that's going to assist incarcerated folks who are legally allowed to vote. So the state board will promulgate regulations and we'll work with the correctional facilities in Anne Arundel County to make that work. That concludes my presentation. Thank you for your support. and I'll take any questions.
Thank you, Mr. Torrey. Do any of my colleagues have questions for the Board of Elections? I don't see any.
Great.
Oh, Ms. Pickard, are you trying to ask a question?
Thank you, Madam Chair. I was just going to say thank you for all your hard work over the last year. I know it was very, very challenging, but y'all really rose to the occasion. So thank you.
Thank you.
Yeah, of the many departments that have had to make pivots and all kinds of changes to accommodate COVID, yours was one of the most prominent examples of having to really be flexible and creative and solve problems. And you all did an excellent job. So thank you very much.
Thank you very much for that. Thank you.
And with that, have a good afternoon, gentlemen. We will move on to the liquor board. We have, or we will have, Miss Judy Hagner from the Liquor Board.
There you are.
Good afternoon.
Good afternoon. Thank you for having me.
Of course. And you are welcome to start your presentation.
I was going to let Beth do her presentation first, and then I will follow through with it.
Excellent.
Okay, good afternoon, Beth McCoy, Budget Office. The Liquor Board begins on page 311 of your budget book. And on the next page, the comparative statement of expenditures, page 312, you'll see that the Liquor Board is proposing a $1.1 million budget for FY22. And this is about $182,900 increase over last year. And those increases are in under the object, under personal services. There's a $42,000 increase. And this mainly reflects the county's pay package, but also moving the chief inspector position from where it is currently as a contractual position to a full-time NR5 position. The $140,000 increase you see in contractual services, that is mainly to fund a new database for the Liquor Board. And with that, I'll turn it over to Judy. Ms. Hagner.
Thank you very much, Mr. Chairman. The increases, especially our database, we are under the original database that was installed for the Liquor Board since 1994. No one in the county can make any improvements to it. They don't know how to update it. We've been basically tying it together with shoestrings to try to get our liquor licenses completed. So far, we have managed this year to go forward with everything. We have finally found someone to build a new database for us that will be top of the line, that should last us for the next 10 to 15 years. So everything has been going smoothly as far as I can see, even with COVID. We have been working steadily in the office. Of course, we cannot let anybody into our building, but myself and our other two full-time people are coming in every day and locking ourselves down. We've been basically issuing licenses. Now we're in our renewal period, which is our busiest period of the year. We have to physically make appointments every 15 minutes for the 600 licensees that we have, or license establishments that we have. We have, we run up and down the elevator and steps to take their materials, run back up, take their money, issue the licenses, and take it back down to them. So this is a very busy month for us. As Ms. McCoy said, we are getting a new full-time chief inspector position that will take effect on July the 1st. And as when we spoke last year, we were supposed to be moving into a new building on Bestgate Road, or off Bestgate Road. As you can see, we're still not there yet, but hopefully within the next several months, we will be moving into a new location. So with that, then we're going to hire another secretary, which we do have an open position for, so to try to ease some of the work off of us. With that, I have nothing else to add. If I'll be glad to answer any questions that you may have for us.
Thank you, Ms. Hagner. Mr. Pruski.
Thank you. Good afternoon, Councilman Andrew Pruski, District 4. Ms. Hagner, I want to thank you and your entire staff. I know that obviously with COVID and the restaurants trying to figure out everything going there, you guys did a wonderful job. I did run into something though, and this is something that I hope that we can maybe address in the future. I understand now.
Sure.
So it's my understanding that the liquor board does not issue new licenses after February 1st if you don't have your paperwork in. And you have to wait.
I'm sorry, go ahead.
Yeah, let me finish and you could maybe correct it.
Sure.
So I had a restaurant in my area, did not have all their paperwork ready by February 1st. They had to wait until May 1st because the liquor board does renewals during that period. And there's obviously, a lot going on. So my question is it possible, and again, I know there's state rules and other things that we consider doing virtual meetings, just like we had a prior conversation, meeting with people. Can you send a credit card payment as far as the lease? Do they have to come to the office? Maybe there's rules for that. But if not, we almost have 600,000 people here in the county. And I know at the delegation level, there was talk, people don't want to hire a chief inspector. There's money in this and that. Let me tell you something. If I'm a business in Anne Arundel, we're going to get more businesses. I want the number of inspectors that we need to get licenses done for staffing. And I'll be the first one to go to the legislature to state that, because if I'm a restaurant and owner and the holdup is we don't have the staff. So again, I don't know the issue, if it's a staffing issue, the way we do business, but I certainly hope that if I'm applying for a license, and I understand we have that period, that if it's March 15th, what's the difference, right? I want to get a license when I get a license and have it approved. So I guess what I'm asking is, it's not a criticism, but what can we do to move forward? Do we need staff? Do we need to do this a different way? Do we need a state law passed? I just think for businesses opening, there should be no delay in the sense that we're doing renewals, whatever else. So if you could help me answer that, and then I could advocate, because I want to solve small businesses that are opening, particularly that industry that's been hit hard, that we can think about it in a different way, because I know they struggled and they probably lost, 3 months of things. And I know there's probably rationale, but I'll stop there and thank you.
Sure, absolutely, sir. Next year will be totally different. We'll be all automated. So basically, they're going to be able to put in their credit card and fill out their renewal. If it is not correct, it will not generate. So if it is correct, then they will be able to print out their own license. Now, as far as issuing a new license or a transfer during that period of time, it is from March the 1st to May the 1st. We cannot issue, and that was because of the old database, how it was set up. So that should completely take care of itself. We did have 6 establishments that were raising all kinds of heck with us because they could not get their license. And to be very honest with you, from the time they had their hearing, which was close to a year ago, they did nothing to get their permits, their everything through the comptroller, through the state, through the county. They did nothing. They just sat on their hands. And then at the very last moment, when they were like, oh my gosh, I've got to get this license. And they were told, we can't issue it. And that it's our fault, it's this, it's that. And I mean, they went to everybody, every delegate, every senator, everybody. I mean, you would not believe the letters they sent us and the emails and things. And I mean, they were not complete, when we cannot issue the license unless it is complete. So, I mean, next year, hopefully this is not going to happen anymore.
Mr. Volkey?
Thank you, Madam Chair. Nathan Volkey, District 3. Ms. Hagner, they came to me too. You know that.
Yes, sir, I do.
So they did go to everybody. And I'm glad to hear that the new system will correct that. You'll be able to fix that. So that's great. I did want to ask you, I have a couple questions about how things have gone over the last year. And I understand Mr. Pruski's point of view on having a full-time inspector. I know there was vigorous debate about this at the state level and a lot of discussion in the delegation and all of that. Have you seen any increase in the workload? So in terms of your inspectors and what they're doing over the past, I'll say year, but really we're probably like 13, 14 months. In the pandemic, were they doing more inspections? Do you anticipate that as we move out of it, that there will be less? Do you have any sense on sort of the workload and what that takes, both looking backward, but also a little bit looking forward?
Absolutely. I can tell you during the pandemic, they were not doing inspections. We were getting complaints from the health department and we were going out online. I mean, these guys were firsthand inside a restaurant, a tavern, a bar, packaged goods stores, and we tried to get them inoculations through the health department. We kept saying, you know, we're out there with the police department. You know, can we get something done? Oh, I'm sorry, we'll get to you. We'll get to you. We had 3 or 4 of our guys come down with COVID. 2 ended up in the hospital because of it. Once this pandemic is over, and I pray it's very soon, then we will get back to our routine inspections. And our workload has increased tremendously. I can tell you, as far as the chief inspector position is concerned, Mr. Harris had put in over 400 and some hours that he was not paid for. And I mean, I don't know how he kept up with it, but he was in here every day from starting around 6:30 in the morning and then going out on the road and meeting inspectors, I'm sorry, and then going out and doing complaint calls with the health department in the evening. So I understand where the delegates were coming from, but I made, per their request, a survey throughout the state of Maryland with MALA, which is an organization for the Maryland Alcohol License Administrators that I belong to. I'm on the executive board. I was on a phone call conference until 4 a.m. in the morning, getting figures for the delegation for their next meeting the next morning of what a chief inspector makes. On the 5 major counties, they were making anywhere between 80,000 up to 125,000. And we were asking for, which was finally done at an NR5. And I mean, I understand, but I mean, it was just uncalled for. And I mean, we have always needed a chief inspector. I have been here, I'm starting my 45th year. And we have needed a chief inspector every year. And I mean, we need more staff. But I mean, we're 3 people running an entire department. So, I mean, honestly, we can use all the help we can get. So that's all I have.
Thank you.
Anyone else have a question for Ms. Hagner? No one else has a question.
I'm getting off easy.
This time you are.
Yes, ma'am.
Can't promise any other year. Thank you for coming in, Ms. Hagner, to our Zoom hearing, and have a great rest of your day.
Thank you. You also.
Thank
Appreciate
you.
it. Bye-bye.
Our last presentation this afternoon is from personnel. And we will have Ms. Ann Badowski, Douglas Hart, and Natalie Fritz. Mr. Teru makes a surprise appearance. Ms. Badowski, you can start whenever you are ready.
Okay, Ann Badowski, Acting Personnel Officer. I think Stephen is going to introduce the pages of the budget book for which our budget can be found.
Madam Chair, members of the council, Stephen Teru from the Budget Office. I'd just like to direct your attention to page 154 of your operating budget book for the Office of Personnel's budget. And I'll turn it over to Ms. Badowski to go through her presentation.
Thank you. Good afternoon. Ann Badowski, Acting Personnel Officer for the Office of Personnel. It's a pleasure to be with you this afternoon. I know that you are all very familiar with the duties and responsibilities of the department. We truly are the one-stop shop for our employees for recruiting and hiring and promoting and timekeeping and paying and negotiating and eventually transitioning our employees to the retirement status. Like all of our departments over the past year, we have found our way, new ways of doing business So we do a lot of our work with our employees and retirees virtually. We now offer our new employee orientation, our pre-retirement seminars, and even our wellness programs all virtually. So it's been a transition in business programs for us this year. Our total budget request for FY22 is $7.47 million, and roughly 70% of that are for salaries and benefits. We have a relatively simple operating budget. The budget does not include any major projects for this year, and it is reduced from last year, and the major reduction in that just comes from last year's one-time funding for the class and comp study. So you won't see that in our budget this year. The request does include a funding for a second cohort in the leadership development training program that we started. What initially was last year, then got put on hold because of the pandemic, but that we did and were able to kick off this past March again. And that is training that is really kind of the first of its kind in the county for current and new managers. It is something that we work together with Anne Arundel Community College to put together with input from our department heads on different topics and skill sets that our managers and future leaders of the county will need. It is a 6-month process, and the classes are right now all virtual, and Anne Arundel Community College is handling that. Our first class will graduate in September of 2021. So our FY22 budget includes funding for a second cohort of 25 participants. The request also includes training for some of our office of personnel staff. Unfortunately, we're not able to take advantage of that in the past fiscal year due to pandemic and just kind of transitioning our business processes and just not having the availability of time to be able to do some of those certificate trainings that we had hoped. So the budget does include that. And we're hopeful that some of our personnel analysts can really take advantage of some of those certification trainings to kind of stay on top of the human relations policies that are most prevalent. I do want to give you an update of several different things that are going on in the department. The first of which is our class and comp study. I'm going to give you an overview, kind of status update of where that stands. The study officially kicked off in October of 2020, last October. And it will examine the classification and compensation of all of our full-time merit employees. It's a county-wide study. The study will provide us with a baseline going forward and ultimately come up with some recommendations for us to consider going forward. Our consultant is PRM Consulting. They're the ones handling this study. And since kickoff, they've actually met one-on-one with all of our department heads to kind of understand their priorities, their issues related to recruiting and hiring and retaining our employees. And they have also hosted several different informational meetings online. We've done them obviously virtually for our employees, our personnel liaisons, our managers and supervisors, just to give a big picture idea of what the study entails. Lastly, we are getting ready. We have finalized what we are calling the JAQ, which is the questionnaire that will be sent to employees for them to be able to fill out what their job details are, and that's what will be used to be studied by PRM. That should be going out by the end of this month. They will have 2 weeks to complete that. And then ultimately we expect a report with recommendations from the vendor in the fall, probably in the October timeframe. I would like also to give you an update on the payroll audit. You may recall that the audit was started back in June of 2018 after we realized that certain pay allowances were not being properly calculated for overtime purposes. The scope of the audit is from 2012 through 2017. The work of the audit has been very extensive, very detailed. There takes a lot of effort, manual effort to sort of research the variances and work with the vendor to get to the calculations. Payments were actually for calendar years 2015 through 2017 were made to employees and former employees in September of 2020. We actually paid out roughly $750,000 to over 3,600 employees who were had hours that were not properly, or allowances that were not properly calculated in overtime. The amount varies by person, but that is what we paid out in September for those 3 year period. After we completed that, we kind of We focused our efforts back onto years 2012 through 2014. And we are working through a final recommendation and hope to make payouts in by the end of this fiscal year to any of those impacted employees and former employees. Lastly, the other update I wanted to just talk you through was our negotiations status and where that stands. We actually negotiated with 7 unions this year. We have ratified agreements with 6 of those 7 unions. The CPSs did not ratify their contract, and we are scheduled for mediation and fact-finding with them later this month. All 6 contracts that were ratified are all 1-year contracts, and we have provided ratified contracts as well as a summary of negotiations to Madam Auditor. So if you don't already have copies of them, they will be available to you. And just in general, for the most part, what we negotiated was a COLA and merit increases for each of the unions. And then with individual unions, there were items negotiated with allowances, uniforms, training, shift differential, and those types of items. Those were all the highlights that I wanted to share with you today. If you have any questions about our budget, I am happy to take them at this time.
Thank you, Ms. Podolsky. Who has a question on personnel? Mr. Volkey.
Thank you, Madam Chair. Nathan Volkey, District 3. So Ms. Podolsky, thank you for your presentation and that information. So I did have a question for you about the FY21 budget. So in FY21, I think if I recall correctly, there were no pay increases for non-reps and exempt employees included in the pay bill. Are you able to tell me if, and if so, how many pay increases or bonuses were given to non-reps and exempt employees in the executive branch since July 1, 2020? And if you would, now you can get back to me.
Yeah, unfortunately, I don't have that at my fingertips, but I can run a report and see if that is the case.
Okay, yeah, so that's non-reps and exempts in the executive branch since 7/1/20.
Okay, thank you.
Does anyone else have a question? We might be zombies. We've been meeting since 9 o'clock. We might think of our questions later.
I was the last thing standing between you and adjournment. I recognize that.
Well, lucky you, I guess, or not. I don't know. Okay, well, I don't see anybody jumping up with a question. So thank you very much for your presentation. And we will get back to you, of course, if we have more questions. And enjoy the rest of your day.
All right, thank you very much.
Thank you. Is there any other business to be brought before the County Council at this time? Seeing none, may I have a motion to adjourn?
Councilman Pruski, motion to adjourn.
And a second?
Allison Pickard, second.
All in favor, say aye.
Aye.
Aye. Any opposed? Hearing none, the motion carries. The County Council is adjourned until 9 a.m. tomorrow, Thursday, May 13th, 2021. Everyone should continue to check the county website for important information